Mari kita divaksin.
Saya sudah divaksin.
Terima kasih Polres Taman Kampus Cirebon, mantap.
Saya siap divaksin biar bisa tatap muka di sekolah lagi.
Kami siswa SMP 9 Tasikmalaya siap untuk divaksin.
Kami ingin sehat dan pandemi segera berakhir.
Biar kami bisa sekolah tatap muka seperti dulu.
Ayo divaksin.
Untuk seluruh pelajar di Indonesia,
Mari ikut vaksinasi
agar pandemi cepat selesai,
dan bisa sekolah tatap muka seperti biasa.
mari divaksin.
Dari vaksin, masyarakat sehat, Indonesia sehat. Terima kasih Polres Tasikmalaya.
Dari Tasikmalaya untuk Indonesia.
Apa? Divaksin? Gaskeun.
Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera untuk kita semua. Perkenalkan, saya Hadiat Niko dari Politeknik Kesehatan Tasikmalaya. Pada kesempatan ini, saya akan menyampaikan penjelasan mengenai hasil inovasi kami berupa ventilator sederhana. Ventilator merupakan alat bantu pernafasan atau biasa disebut resusitator. Dalam masa pandemi COVID-19 saat ini, kebutuhan alat bantu pernafasan sangatlah diperlukan dalam penanganan gawat darurat penderita COVID-19. Untuk memenuhi kebutuhan pasien COVID-19 yang mengalami masalah pernafasan, alat yang ada di Kota Tasikmalaya masih sangat kurang. Melihat permasalahan yang ada, kami, tim dari Politeknik Kesehatan Tasikmalaya, membuat sebuah inovasi berupa ventilator sederhana untuk menanggulangi masalah gangguan pernafasan ringan sampai sedang pada penderita COVID-19. Ventilator sederhana hasil inovasi kami sudah dilakukan uji kelayakan di BPFK Jakarta pada tanggal 12 Mei tahun 2020. Hasil uji coba alat tersebut ada beberapa masukan terkait dengan penyempurnaan dalam hal kerja alat. Prototipe alat ini dijadwalkan untuk uji kelayakan tahap kedua di BPFK setelah perbaikan berdasarkan masukan dari pengujian tahap pertama. Dalam video ini, kami baru sampai pada tahap gerak mekanik. Untuk program elektrik dan program komputerisasi akan dijadwalkan kemudian di pengembangan inovasi ini. Besar harapan kami, mudah-mudahan hasil inovasi ini bisa mendapatkan ventilator yang berfungsi maksimal dengan harga yang murah untuk menanggulangi permasalahan penanganan gawat darurat gangguan pernapasan pada pasien darurat COVID-19. Demikian penjelasan inovasi dari kami, Politeknik Kesehatan Tasikmalaya. Semoga bermanfaat. Wassalamualaikum warahmatullahi wabarakatuh.
wabarakatuh. Nama saya Emma Kamelia. Saya berasal dari Poltekkes Kemenkes Tasikmalaya dari jurusan keperawatan gigi. Pada kali ini saya akan memperkenalkan topik inovasi baru yang berasal dari Poltekkes Kemenkes Tasikmalaya yang dinamakan extraoral suction. Cara penggunaan alat ini yaitu pertama-tama kita hidupkan ada tombol. Ya, di sini tombol on off-nya, dan ini adalah untuk yang kedua untuk mengatur kecepatan. Ya, jadi kecepatan untuk penyedotan ini kita bisa atur di dalam tombol ini. Nah, kita akan coba untuk kita hidupkan ya. Ini adalah tombol untuk on, atau kita hidupkan di awal untuk start ini. Jadi produk aerosol yang berasal atau kotoran yang berasal dari mulut pasien, dari gigi, pengeboran gigi, dari pembersihan kanan gigi atau produk jenisnya akan masuk ke sini, dan dia akan terus berjalan masuk ke dalam kotak filter ini. Nah, di mana di dalamnya itu berisi cairan klorin. Ini adalah cairan yang sangat penting karena cairan klorin ini adalah untuk membunuh virus, bakteri, mikroorganisme atau dan sejenisnya. Ini akan dibunuh oleh klorin. Nah, apabila sudah tertampungnya banyak, maka dapat dikeluarkan melalui filter kecil yang ada di belakangnya yang sewaktu-waktu bisa atau dapat kita buka. Alasan penggunaan alat ini karena alat yang ada masih berupa alat yang diimpor dari luar negeri. Jadi di sini kami coba untuk membuat dan merakit sendiri alat-alat yang ada di seputaran daerah kami, yaitu di kota Tasikmalaya, dan kami rakit menjadi bentuk seperti ini dan sangat-sangat bermanfaat sekali untuk di era pandemi, khususnya pada era new normal. Alat ini sangat murah dan sangat-sangat bermanfaat digunakan untuk tenaga kesehatan gigi. Demikianlah penjelasan kami tentang produk baru inovasi dari kami, dari Poltekkes Kemenkes Tasikmalaya jurusan keperawatan gigi yang bernama extraoral suction. Di mana extraoral suction ini sangat-sangat amat berguna dan bermanfaat untuk masa pandemi COVID ini, khususnya di era new normal. Terima kasih atas perhatiannya dan wassalamualaikum warahmatullahi wabarakatuh.
Ladies and gentlemen, the opening ceremony is going to start soon. Excellencies, distinguished guests, participants, ladies and gentlemen, Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. We are delighted to welcome you to the first International Conference on Health, Education, and Technology, or we simply call it ICHET 2021. It is the first conference series held by Poltekkes Kemenkes Tasikmalaya on the theme of Interprofessional Collaboration on Resilience in Health and Disaster Emergency. First of all, let me introduce myself. My name is Kanita Wulandara, and I will be the master of ceremony for this event. This conference brings together academia, researchers, health provider, and interprofessional collaboration practitioner who are responsible for delivering sustainable and eco-friendly solutions on health, disaster emergency, nursing and midwifery, health science, education, medical technology, and also sharing the latest research findings. It is an honor to me to introduce and welcome all the guests here. Dirjen Tenaga Kesehatan, Dr. Gigi Arianti Anaya, MKM, the Director of Poltekkes Kemenkes Tasikmalaya, Mrs. Ani Radiati, Bachelor of Education, Master of Health, the Vice Director 1, Poltekkes Kemenkes Tasikmalaya, Mr. Iwan Somantri, Master of Nursing, the Vice Director 2 of Poltekkes Kemenkes Tasikmalaya, Mrs. Deris Aprianti, Master of Health, the Vice Director 3 of Poltekkes Kemenkes Tasikmalaya, Mrs. Wiwin Mintarsi, Bachelor of Applied Science, Master of Health. And also, we welcome all the presenters and participants of International Conference on Health, Education, and Technology on the theme of ICHET 2021. Here we have Dr. Perjit Kaur Singh from Mahsa University, Malaysia, Dr. Emma Camelia, Master of Biomedical Science from Poltekkes Kemenkes Tasikmalaya, Indonesia, Dr. Laith Burrows from Flinders University, Australia, Dr. Dini Mariani, Nurse, Master of Nursing from Poltekkes Kemenkes Tasikmalaya, Indonesia, Dr. Nur Rahman, Master of Science of Agriculture from Poltekkes Kemenkes Malang, Indonesia, and last but not least, Professor Meral Huri, Associates PhD from HTCP University, Turkey. Thank you for attending this Zoom meeting. Now, ladies and gentlemen, we would like to present you to the traditional Sundanese dance, Sancang Gugat. Please enjoy.
Ketika sesama berhasil kumang di nasib berenang. Ukur merobot mata diri tedaya upaya. Mundurnya tealakur barayanya paburantak sancang ku gangrek bebelang kerlemah cai bertiwi. Di mana
For a brief moment, we would like to invite you to sing Indonesian anthem, Indonesia Raya.
Indonesia
Ladies and gentlemen, before we begin, allow me to read the main agendas of the conference. We will begin by addressing report from the Chief Committee, welcome speech from the Director of Poltekkes Kemenkes Tasikmalaya, official opening by Dirjen Tenaga Kesehatan, and followed by the introduction of Center of Excellence Health and Disaster Emergency Center of COA HD Center. Let us now begin with Basmalah. Bismillahirrahmanirrahim. Distinguished guests, participants, ladies and gentlemen, as the host of the conference, the Chief Committee will be delivering the report speech. Please warmly welcome Dr. Emma Camelia, Master of Biomedical Science.
Thank you, Ms. Kanita Wulandara, and thank you for the time. Assalamualaikum warahmatullahi wabarakatuh. Good morning to one and all present. Honorable Chief of BPPSDM Kesehatan, Honorable Director of Poltekkes Kemenkes Tasikmalaya, respected speakers, distinguished presenters, dear colleagues, ladies and gentlemen. It gives me immense pleasure in welcoming all of you to the first International Conference on Health, Education, and Technology, or ISET 2021. Today, we are going to discuss about a very important topic, i.e. interprofessional collaboration on resilience in health and disaster emergency, which is among the most frequently discussed issues with significant implication for facing the challenges of crisis, the field of health caused by disaster and emergency. Disaster and emergencies have significantly affected aspects of people's lives, especially those related to health. This required a rich collaboration of teams in order to be effective. As a result, interprofessional collaboration is a foundational underpinning of disaster preparedness. Interprofessional collaboration and education increase knowledge of the roles and responsibilities of various healthcare disciplines and improve collaboration for the work plan. Interprofessional collaboration together with health services or healthcare and emergencies management are the trident that can be relied on to carry out disaster preparedness and health emergencies. Universities must be able to play an active role as agents of change in facing these challenges. Against this background, we have assembled here to know more about the topic with many eminent speakers lined up for today's conference. With this brief background, I will welcome our guest, Dr. Lake Burrows from Flinders University, South Australia, Dr. Perjit Kaursing from Masta University, Malaysia, and Meral Yuri Associate Prof from University of Hacettepe, Turkey, for sharing their views on this pertinent subject. I will, on the behalf of our college, again thank you, Dirjen Nakes Dr. Arianti Anaya, MKM, for accepting our invitation. I also would like to extend my gratitude towards our director for encouraging us to conduct a conference today, for the kind support, suggestion, and guidance given to us. It is my great pleasure to welcome all participants who have joined this conference to present their view. Our presenters in ISET 2021 come from various regions in Indonesia, as well as from various universities, such as lecturers, practitioners, and students with education ranging from diploma, undergraduate, graduate, and postgraduate degree. I am delighted to have all the students and fellow colleagues for participating and sharing in this special occasion. May this conference be characterized by fruitful, thought-provoking discussion, which will lead to the great collaboration on resilience in health and disaster emergency. Thank you. I am giving it back to moderator, Ms. Kanita Wulandara.
Thank you, Dr. Emma, for the report speech. We are now going to listen to the welcome speech via a video that we have prepared, delivered by the Director of Poltekkes Kemenkes Tasikmalaya, Mrs. Ani Radiati, Bachelor of Education, Master of Health.
Baiklah. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. It is our privilege and great pleasure for me to welcome you to the first international conference on health, education, and technology 2021. I would also express my sincere appreciation to the organizer of this wonderful event. Ms. Emma, thank you so much for leading your team to create this event. We would not have been here in this beautiful association without you and the team. I am especially honored to welcome Ms. Arianti Anaya, Dentist Master of Public Health, as the head of Direktorat Jenderal Tenaga Kesehatan, Ministry of Health, Republic of Indonesia, and also the honorable invited speaker in this event. Thank you for being here with us today. And welcome to all participants. We are delighted to have you with us to participate in this international conference. In today's event, our agenda is to focus on the interprofessional collaboration on resilience in health and disaster emergency. As we know that disaster and emergency have significant affected many aspects of people's life, especially those related to health. For example, the COVID-19 pandemic has forced the world community that a pandemic or emergency condition can arise at any time. The face this condition, it is our duty as an expert in management, education, science, technology, and so on to take part in the preparedness and handling of the disaster and emergency condition. To answer the challenge Poltekkes Kemenkes Tasikmalaya has held a disaster emergency or HADE center as our center of excellence. So I hope that through this event, we can learn to grow and to strengthen our collaboration professionality. I'd like to take too much of your time, so I will ask Ms. Arianti Anaya to officially open today's event. That is all for me, so I would hand it over to MC Ms. Kanita to proceed to the next agenda. Once again, welcome and thank you very much for attending this event. Sekian, wassalamualaikum warahmatullahi wabarakatuh.
We are now going to listen to the introduction of Center of Excellence Health and Disaster Emergency Center, delivered by Dr. Siti Badriah, Nurse, Magister of Nursing, Community of Health. Dr. Siti Badriah, time is yours.
Thank you very much, Ms. Kanita Wulandara. Assalamualaikum warahmatullahi wabarakatuh. The Honorable Dirjen Tenaga Kesehatan Dr. Gigi Arianti Anaya, Master in Public Health. The Honorable Director Poltekkes Kemenkes Tasikmalaya, Hajah Ani Radiade, Bachelor of Education, Master of Health. The Honorable Speaker, Dr. Perjit Kaur Singh, Pormahsa University. Dr. Laik Burrow from Blinder University, Australia. Meral Huri PhD Associate Professor from HCTV University, Turkey. Dr. Nur Rahman, Master in Agriculture for Poltekkes Kemenkes Malang. Dr. Gigi Kamelia, Master in Biomedical Science, and Dr. Dini Mariani, Master of Nursing from Poltekkes Kemenkes Tasikmalaya, Indonesia. Good morning, ladies and gentlemen, the participants of the first International Conference on Health, Education and Technology, Interprofessional Collaboration on Resilient and Health and Disaster Emergency. In this moment, I would like to share about Center of Excellence HADE Center Poltekkes Kemenkes Tasikmalaya. Please slide. Our topic today is the prospect of research and study on health emergency and disaster based on local culture at HADE Center, Poltekkes Kemenkes Tasikmalaya. Slide. As a background, Indonesia is an archipelago located in the junction of the four tectonic plates. They are the Asian continent plate, the Australian continent plate, the Indian Ocean plate, and the Pacific Ocean plate. In the southern and the eastern of Indonesia, there are rings of fire that lie from the Sumatra, Java, Nusa Tenggara, and Sulawesi. There is consists of volcanic mountain and lower land which dominated by swamp. That condition can cause this disasters such as volcanic eruption, earthquake, tsunami, and flood. Next. As you know that the pandemic COVID-19 has happened in Indonesia since 2020 up to now and gives significant impact on the physical, psychological, social culture, economic, and condition of spiritual. So that the government has declared that it was national disaster. To responding that issue, Poltekkes Kemenkes Tasikmalaya has developed Center of Excellence Health and Disaster Emergency or HADE Center as contribution in disaster prevention management in Indonesia, especially in Tasikmalaya, Cirebon, and surrounding areas. Slide. Here, ladies and gentlemen, about our vision and mission of HADE Center. The vision to become a national reference center of excellence in science and technology in the field of health and disaster emergency. And the formation, the first to organize applied education and health training in the field of emergency and disaster at local, regional, and national levels. The second, researching and development the health and disaster emergency in accordance with progress in science and technology at the national and international level. The third, conducting community service activities and dissemination in the field of health and disaster emergency. And the fourth, strengthening partnership institution and network to increase the capacity of HADE Center at a national reference center. Slide. And how about the relation of the research focuses of HADE Center in with government policy and Poltekkes Kemenkes Tasikmalaya Research Development Master Plan? In this slide, we can say that the development of emergency health disaster product based on local resources are really integrated with the government policy and Poltekkes Kemenkes Tasikmalaya Research Master Plan. Slide. Ladies and gentlemen, we can see from this slide that the roadmap of HADE Center is divided into periods. For the first period, in 2019 up to 2021, focus on basic research product development and therapeutic studies and intervention of health emergency and disaster. And the second period, in 2022 up to 2024, focuses on downstreaming and commercialization of product development of health emergency and national disaster. And the third period, in 2025 up to 2027, focuses on health and disaster emergency research study through interprofessional collaboration involving international agency or international joint research. Slide. And here it is, the result of the research and development HADE Center. The first, development of food product and nutrition policy of disaster emergency. The second, management of health emergency with a local culture approach. And the development of medical devices of health emergency. And health services for trauma healing in disaster victim. And the last one, development of health product for the COVID-19 pandemic. Ladies and gentlemen, this is publication of the development of food and nutrition policy in disaster emergency, and this article has publication at accredited scientific journal Sinto 4, Agrocreative with affiliation of HADE Center Poltekkes Tama. Slide. Okay, this is the picture. So how the collaboration between BPPD Tasikmalaya Regency and HADE Center, especially in the use of the technical book and food services management in disaster emergency. Slide. And this is the result of research of emergency food, consists of cookies, food bar, and dodol with the ingredient hanjeli flour, cassava, nut or kacang garut, and tilapia, sweet potatoes, green bean, and catfish. Slide. This is the patent progress emergency product research result. Slide. Ladies and gentlemen, and the next one, we got product health drink Honje Manje. Honje Manje is a healthy drink to increase our immunity during the COVID-19 pandemic. And healthy drink Honje Manje is made from Honje plant. Honje is a type spice plant and commonly found in the West Java. Besides Honje Manje, we have got another healthy drink which called is teh talang and kunyit asam. And the last product we have got frozen dessert velva. There is combination guava with sweet potatoes for a best adolescents. And this is agreement on the implementation of research between Poltekkes Kemenkes Tasikmalaya and the health research of development of center. Yeah. Besides the previous research, I have explained, we have got another research that we call oyog. One of the culture in the pregnant in the Cirebon Regency that can be an educational medium about pregnancy danger sign is oyog. The previous research conducted by research has proven that the level with oyog modification provide benefit including maternal anxiety and increasing midwife empathy. So, effective communication, suggestion and affirmation of level examination with oyog modification, making the patient comfortable and easy to receive information about the danger sign. And oyog can be implemented as culture-based policy in Cirebon Regency. Slide. Okay, this is a picture relationship to oyog research modification module and intellectual property rights. Okay. Ladies and gentlemen, this is another research about ESA Cair Pol Chairbird. ESA stand for Ekonomis, Sehat, dan Aman. As we know, 2.8 until 4.7% labor in sleeping position experiencing prolonged labor. Prolonged labor is one of the causes of the increased maternal mortality rate and infant mortality rate. And ESA Cair is one of labor support method that is designed such a way in which mother gives birth in sitting position. So it is more comfortable. By paying attention to gravitational force, it is hoped that labor in the chair will be shorten length of the process of the childbirth. Slide. So we can say there are several for benefit ESA Cair for the childbirth. The first, the delivery process is faster, and then patient mobilization easier, and helping childbirth is relatively easier. Slide. Ladies and gentlemen, another research in the development of non-invasive blood sugar test was carried out using nearly 1,550 nanometer sensor fired with photodiode. And this article has later acceptance to publish in Journal Biomedical Engineering or JBBA Scopus Index Journal Q4. Okay, here it is product of HD Center which were licensed. They are alternative bur and simple ventilator prototype. These products are made as response for the COVID-19 pandemic need. And Alhamdulillah, in the Edu Health Fair event, simple ventilator prototype become the first winner. The first winner as the competition among the Poltekkes Kemenkes Tasikmalaya. Ladies and gentlemen, we continue to another slide. Yeah. Okay, this is our activity. Is this the stage that has been taken to downstream HD Center product by benchmarking to University Diponegoro Semarang, Indonesia. And then slide. This is cooperation agreement between HD Center with Symbiomes and Korem, University of Diponegoro Semarang. And we continue to downstreaming. Next. To research product HD Center to PT Choice Plus Makmur Semarang, Indonesia to make agreement. Slide. Yes, this is the HD Center Product Marketing Cooperation Agreement, especially in disaster emergency food. Okay, ladies and gentlemen, this is a picture about the commercialization. And the next slide, we can tell about Pasca Traumatic Hypnotherapy Training for Medical Worker in Tasikmalaya. In this slide, explain that HD Center has produced hand sanitizer for community service activities during the pandemic COVID-19. Okay, ladies and gentlemen, well, this brings me to end my presentation. Let's conclude that HD Center was formed as part of the contribution Poltekkes Kemenkes Tasikmalaya in overcoming health emergency and disaster in Indonesia. Some of HD Center products, they are emergency food products, and appropriate technology during the COVID-19 pandemic had been used by the community in the form of the community service activities in Tasikmalaya, Cirebon, and the surrounding area. Partnership networks are needed to increase the existence of the capacity of HD Center as a national reference center. Okay. And the end of my presentation, I would like to quote saying from Rose Kennedy that life isn't a matter of the milestone, but of the moment. So let's be part of the problem solver to solve the nation problem, especially in emergency and disaster. Maybe that's all. Thank you for your great attention. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Dr. Siti Badriah. Now, we are going to listen to the speech an official opening delivered by Direktorat Jenderal Tenaga Kesehatan, Ibu Dr. Gigi Arianti Anaya, MKM. She will be giving her speech in Bahasa. Ibu Dr. Arianti.
Ya, terima kasih. Assalamualaikum warahmatullahi wabarakatuh. Good morning, distinguished all officials from Ministry of Health, Director, Vice Director, and faculty members of Health Polytechnic Tasikmalaya, guest speakers, all presenters, ladies and gentlemen. First, let me praise God, Allah Subhanahu wa Ta'ala, for all the blessings so we could attend the International Conference of Health, Education and Technology that is hosted by the Health Polytechnic Tasikmalaya. I am pleased to welcome this conference. During this event, all academic members of Health Polytechnic could exchange knowledge and scientific findings related to current situation, especially on the pandemic COVID-19, and particularly in combating pandemic COVID-19 through the implementation of evidence-based practice and health technology in preventing, detecting, and treatment of COVID-19 and other health problems as well. Ladies and gentlemen, pandemic of COVID-19 has taught us about care, humanity, solidarity, and unity to face the challenge due to the infection of the COVID-19 virus. I believe that Health Polytechnic, as one of technical implementation unit under the Ministry of Health, have been participating in all efforts to combat the pandemic either by health education for community to comply the health protocol, doing research and community services related to COVID-19, and also conducting vaccination. One of the important thing, I think conducting vaccination center to expand coverage of vaccination in achieve the herd immunity. Other lesson from the pandemic COVID-19 is that we have to make a transformation health. Through the pandemic, we have been realizing that it is important to fix the system problem in the healthcare services. Therefore, health system transformation has become very crucial for us. The health system transformation are including transformation of primary healthcare, transformation of several systems, transformation of the health security or resiliency system, transformation of the health financing, transformation of the human resources for the health, and also transformation for the health technology. Ladies and gentlemen, on this opportunity, I would like to ask Health Polytechnic to participate in health system transformation by strengthening the implementation of 3 academic pillars, Tridharma Perguruan Tinggi, that is focused to achieve the high quality of the primary and referral health care, and also hoping that through this conference, Health Polytechnic, particularly Health Polytechnic Tasikmalaya, could provide problem-solving mechanism to through scientific approach as well as the production of innovation in digital healthcare and telehealthcare to be utilized in handling pandemic COVID-19. Ladies and gentlemen, to all participants, I suggest you to take participant actively in the conference. And for all the committee members, I also would like to thank for all your hard work to conduct this event. And by saying Bismillahirrahmanirrahim, I'm officially open this conference. Thank you and happy conference. Terima kasih. Wabillahi taufiq wa hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Wassalamualaikum warahmatullahi wabarakatuh. Thank you, Ibu Dr. Gigi Arianti, dan mohon izin untuk foto bersama. Ladies and gentlemen, for a brief moment, we will take a screenshot of our attendance. To all guests, especially from Directorate Jenderal Tenaga Kesehatan, the Director of Poltekkes Kemenkes Tasikmalaya, and Dr. Perjit Kaur Singh, you may turn on your camera. Be ready. Yeah. Ladies and gentlemen, we have come to the core agenda of our meeting. That is to hear the plenary speech from our invited speakers. The plenary speech will be divided into two sessions. The first session will be moderated by Mrs. Sinar Pertiwi, Bachelor Degree in Midwifery Education, Master Degree in Public Health. And second session will be moderated by Mrs. Ida Rosdiana, Master of Nursing, Medical Surgical Nursing Specialist. Before beginning the first session, allow me to read the CV of the moderator. Mrs. Sinar is currently one of the lecturers in Midwifery Department at Poltekkes Kemenkes Tasikmalaya. She earned her master degree in Health and International Development at Flinders University. Her latest organization experience, namely as Midwifery Accreditation Assessor of Lampetekkes and Human Relation and Advocacy in West Java Midwifery Organization. Mrs. Sinar, time is yours.
Thank you very much, Ms. Kanita, for the introductions. Good morning. Assalamualaikum warahmatullahi wabarakatuh. Salam, Om Swastiastu, Namo Buddhaya, salam sejahtera untuk kita semua. Honorable Representative from Direktorat Jenderal Tenaga Kesehatan, Republik Indonesia, Dr. Gigi Arianti Anaya, MKM, Honorable Director of Politeknik Kementerian Kesehatan Tasikmalaya, Honorable Distinguished Guest Speakers, ladies and gentlemen, welcome to the first sessions of the first International Conference on Health, Education and Technology, ICHET 2021. The first ICHET theme is Interprofessional Collaboration on Resilience in Health and Disaster Emergencies. It's been an honor for me to be a moderator for these sessions, and it's been an honor too to have three prominent speakers, Dr. Perjit Kaur Singh from Mahsa University, Malaysia, Dr. Lee Burrows from Flinders University, South Australia, and Dr. Emma Camelia from Politeknik Kementerian Kesehatan Tasikmalaya, who will deliver insightful topics in the field of health and disaster emergency, health education and medical technology in health crisis. Why these topics are important? As we all know, ladies and gentlemen, disaster continue to pose substantial threat to human health worldwide, since we cannot always predict when, where, and how much the impact to human well-being. Knowledge in the principle of disaster and health crisis management, as well as the wider functions of the health system, are there essential for healthcare teams who must respond effectively in dynamic environment. As health provider, surely we need to have more knowledge and skill in the disaster management, health in crisis, health disaster education, and health technology. And that is why we are having three prominent speakers for the first sessions. Interprofessional collaboration in the foundation of effective healthcare team is also a key, as well as we know that we are, as a leading sectors in education, we need to really giving and engage for our student, for our health provider, the informations about the disaster management, how we can do it and how we can implement it to the society. And hopefully with this session, we can have more knowledge and more skills to do the best thing for our community. Without further ado, let's start our sessions. Now I would like to welcome our first speakers, Dr. Prajit Kaur Singh from Master University, who will be delivering a speech with the title Management, Healthcare and Disaster Management. Welcome, Miss Prajit Kaur Singh. Okay. Before I'm heading to the session, I would like to give a brief of our first speaker curriculum vitae. Dr. Prajit Kaur Charanjit Singh. I'm sorry if I'm pronouncing your name incorrectly, Dr. Prajit. She's been like 27 years in nursing and healthcare accreditations and patient safety and quality. Her latest educations, starting from certificate in medical education in 2013 at University of Dundee, United Kingdom, and then continuing to Master of Nursing in 2016 in Auburn University, Malaysia. And her latest doctorate degree is of Business Administration in University Sains of Malaysia. Her work experience have been like, the latest one is Director of Nursing since 2014 and 2017 in National Guard Health Affairs, EMBAH Madinah, Saudi Arabia. And then has already been a Chief Nursing Officer at Bagan Specialist Center, Butterworth, 2017-2018. And now she's currently as a senior lecturer in the Master University. Her research and presentation, she got the latest two topic of research. The first one in 2019 is about the reward of saving life in Islamic perspective, but utilization of assessment in Bagan Specialist Center. So the early warning scores and care of the deterioration patient can help rapid response team in improving outcome, and was presented in the Journal of Education and Social Science. And the latest one in 2020 about patient safety culture in perspective of millennials, a case study in Malaysian private hospitals. Her skills is on nursing healthcare leadership management, patient safety and quality, implementation of hospital-wide early warning scores, international care rounds, electronic health information systems. Welcome, Dr. Prajit, to ECHAT 2021. Before we begin, let me briefly explain the rules of the sessions. Today, we will broadcast live and it being recorded to be available for post-conference archive. So the participants are not allowed to turn on the microphone during the speaker presentation. Each speaker will be given 20 minutes maximum for delivering the presentation, and the question and answer session will be held after all speakers delivering the presentation. It will take about 30 minutes question and answer. The participant will have the opportunity to submit the question for today's speaker at any time during the presentation. You may use the chat features in this Zoom meeting. So that is the brief rules. Ladies and gentlemen, without further ado, I would like to invite Dr. Prajit Kaur Singh to the session. Dr. Prajit, the stage is yours.
Thank you. Thank you. Good morning. Selamat pagi. Selamat sejahtera. I hope I'm clear. Can you all hear me?
Yes, we can hear you, Dr. Prajit.
Yeah. Thank you, Miss Sina. Thank you very much. And I must begin by complimenting the committee. We are very proud of Indonesian culture, Asian culture. I am particularly very impressed with your Sancang Gugat. That was very awesome, I would say. Thank you very much for that. And yes, the national anthem, you know, it brought tears to me. Okay. Let me share screen for my presentation. Yes, I'm from Masha University, and as you can see in the background, this is Masha, and I'll be talking about management in healthcare and disaster management. Okay. So, yes, as the presenter, spoke earlier on, we have a lot of disaster issue, especially in Indonesia and Malaysia, and yes, worldwide. Now we have a COVID-19 problem, which, it drained out all our resources. And just recently we had volcano and, tsunami and floods and so on, which is actually draining our resources, right? So we really need to look into the management of the healthcare and the leadership aspect and how we can help ease this disaster issues and bring some innovations into this, right? So moving forward, one of the key points that we cannot stay away is by embracing technology. And I think this was made very clear in the beginning of the speech. And we are very well aware that technology is the way how we can move forward, how we can fasten things, just like all of us now, right? We are having a conference with a finger click. And yes, I will leave this topic of technology to the next speaker, who's I think she will elaborate better, right? So, but just a key point from me is implementing technology in managing disaster, not only disaster, in the management of healthcare itself. Not only that, it will help us overcome, it can help us detect, and it costs us money, really. And as developing country, it's going to be a little bit of a challenge. And I'll talk a few key points how we can move forward with that, probably that will give us some insight. And the second key point we need to remember is generational competency. As much as we don't think generational competency is important in management, really, when we look, a lot of things we do, but because we have a lot of issues like high staff turnover, right? And this is so prominent nowadays, especially with millennials coming into the picture. So their taste is really different in workplace. They really look for different way of looking into things. They don't just accept things as it is. They really want to contribute to the change. And when they don't see they are being engaged, they really move from one organization to another organization. That is really making our management or the whole healthcare system is destructive, right? It collapses our healthcare system. Now, if we do not understand what is their need and we don't know how to engage them and to keep them and to use them to our best, this is going to cost us a lot of money because, high turnover rate. And when we are trying to implement some quality system or some new projects, and you see that with high turnover rate, our project is not going to be very successful. So really having this understanding of a different generational need. Now Generation Z is going to come into the picture as well. So without knowing their needs and without being aware of that, we are going to be at great loss. Right? So moving forward, general competency is a must. And yes, embracing diversity, diversity in many terms, cultural diversity, and incorporating a lot of different views, right? That it's really important. And yes, and we must not forget this very important aspect, sustainability issues. A lot of us will be talking about, how a leader must do, how he too can do so many things, but we forget the impact that it's gonna leave to the next generation. So currently, there's a lot of issues that are coming up with climate change and go green issues and all that. So embracing sustainability issues, not only in terms of climate, but in terms of business model itself is very important, because if we can't sustain by doing all the few things that I was talking about, embracing technology to make our work easier, generational competency, diversity, and all that, we would not be able to sustain whatever we are doing. So sustainability issue is not only a climate issue, but it's a business issue as well when we look in that model. So moving forward, leaders need to have awareness about how we can sustain the business. And only then it will be really a successful. Right. Most important one, I would say, is to have the concept of proactiveness versus being reactive. Yeah, reactive is when something happens and then we go and try to resolve that particular issue or disaster in this sense, right? But if we can incorporate policies such as being proactive, and we have policies in place, we always do a lot of things like risk management and all that. If we have a lot of strategies like having team training ready for a disaster, always testing our system, finding for a potential problem that has not occurred. That really is an art to become prominent healthcare leader, and this is the way forward. And really, then of course, as earlier spoken, we should really have evidence-based protocols that are really been well searched. We have a lot of resources to do that. However, if we're going to develop evidence-based protocol from the beginning, it's going to take us a very long time. And the way to move forward is like we can have affiliation, like what we are doing now, Polytechnic and Masha, and with a lot of other universities and other organizations, healthcare organizations that already have experts who are doing a lot of protocol, and we can adapt from there so that we do not reinvent the wheel, and it gives us a fast way of doing things, right? So evidence-based protocol is really needed, and I'm sure all of us have it, but the way how we can enhance it is by creating a better network so that we can share those ideas across, right? Right, and one of the important thing in disaster management is always to allocate a dedicated personnel to handle disaster, right? We cannot say, okay, if I'm the CEO, if I'm the nursing director, also I will be in charge of the disaster, or giving it to one unit or one particular let's say emergency department is going to be handling the disaster management. And we really need an expert, right? the expert who is knowledgeable about disaster management, and he or she particularly focused on looking into disaster management, looking into the issues that can happen in that organization. That is why I spoke about earlier, being proactive, right? So this particular personnel must be really well versed with not only the standards, but he or she must be good in utilizing a lot of tools to find out the root cause or to find out the potential problem that's going to occur in that organization. So yes, global networking, I think we have spoken about this as well. It is very important because it is the fastest way to move forward now with technology and all that. If we can have a faster way, how we can do research, how we can combine ideas and come up with faster rules, the way we can manage things, right? So basically our aim is going to be to give quality care, optimal care, because our resources have been drained from due to all these disasters coming, and since then we don't want to compromise our quality in healthcare, and of course we want to give better outcome to the society, right? All right, and one important thing we cannot get away is good corporate governance. We understand in countries, developing countries like Malaysia, Indonesia, we have a lot of issues with corruptions, power corruptions and all that. Well, if we do not incorporate good corporate governance system into that, and where we implement risk management and also double checking the work and all that, we will always not have the resources to move forward, to flourish in the disaster, right? So every organization need to strive to incorporate good corporate governance, so that all the higher people, the board of directors, they are accountable for what they are doing. And yes, risk management is the way forward. Okay, it's not only in terms of finance, in terms of the disaster, what is going to happen, and I cannot say more, right? Risk management is a huge subject, and we, the healthcare leaders, we really need to be an expert in this field and engage all our team, give awareness to the team, and start incorporating risk management subject in our curriculum, so that we can make sure that the disasters will be managed very well, right? And yes, I was very impressed with the ventilators and all the innovation research that was presented earlier, and this is how we can really move forward. Innovative thinking, okay, incorporating design thinking in our whatever we are doing, and that, yes, really will bring a lot of change. And incorporating design thinking will prevent us from making mistake in a way when we are trying to design something, so that we do not lose a lot of money in that term, and we get the product in a very effective way. It is a huge subject, design thinking. However, I'm just giving the overview of the whole system. A lot of us want to be creative, we want to innovate and all that, but if we forget the process of design thinking, and how we can prevent from disaster, that will really be. Okay, my last key point is on incorporating blue ocean strategies. And thanks to Chan Kim and Renee for contributing to this great framework of incorporating blue ocean strategies as healthcare leaders. You know, we want to move from disaster planning to a crisis leadership, and that really involve a lot of work, a lot of ideas, a lot of to bring the niche to find out our core problem and how we can move from the way we are doing things now to make things more feasible, more economical, and more sustainable. Right? So I would say that Blue Ocean strategy should be incorporated. And yes, crisis leadership is very important. And if all our leaders are together and we use certain strategies, Blue Ocean strategies, to see all our problem and how we can combine all that so that we are together and we build a system that is so sustainable and it will be a workable idea instead of that. So basically the key takeaway from my presentation earlier was a few ideas. We say experts should be the leaders, right? There should be someone who's very well aware of the disaster, the management, what are the quality aspects, and how we're going to be prepared, how we can do the simulation trainings for our team and all that. So include experts in our in the disaster management. That is very important. And yes, increase networking, right? What we are doing now, Masha and Polytech is really having great networking. Probably in research we can expand in that issues, but yes, in also we can look into issues and how we can disperse our and share our resources, so that because we are from a developing country, we do not have as much money or power as the developed country, and so we can be very innovative when we have good network and we start sharing views and expertise, so that we can compensate for the financial aspect, right? Yes, and remember, we set to make out the difference as leaders, right? So incorporating innovative strategies that I was speaking earlier on, design thinking, all these strategies of blue ocean strategies into our management, it can help us, right? Having the risk awareness and crisis leadership, that can make our strategies more effective, that can sustain the whole concept, and then we can function more effectively in a disaster. Right. Also, just my last keyword is creators. We are the creators of a dream of excellence. Being proactive is the keyword, and we cannot get away with without this. And if we do not have a lot of proactive in our healthcare leadership styles, then we cannot handle issues that are being said. It is so sad to say that we have a lot of ideas how we can manage disaster, but when come to think about it, it's very difficult to be prepared for it or to even know when it is happening, right? So this is where we're going to, I hope in today's sessions with other speakers giving their input, expert input in education, in technology, and so that can bring us awareness of how we can bring up our proactiveness, right? So before waiting the disaster to happen, we know what to do. We are well prepared. We organize our team. We have adequate protocols. We have a system in place. Now, before I end my sessions, one of the key points I really like to say is that we need to understand that issues of managing disaster is a system issue. It's not one person issue. It's not the responsibility of a leader, one person, or that particular organization or the particular government. We cannot say that. It is a system issue, and we got to strengthen the whole system. That's why I was speaking about the Blue Ocean strategies and incorporating design thinking ideas into the whole system, so that we can identify what is it in the system that can be improved, rather than trying to just organize the whole team and finding out how we can best approach it. So if we look into the whole system, that would be an excellent, and really we can make a lot of difference in that. So with that, I thank you for your attention, and I think we're going to have a great day today with all other speakers and giving us better insight into education, technology, and many other ideas, and particularly how we can enhance that. Thank you very much.
Okay, thank you very much, Dr. Prajit Kaur Singh, for addressing an important topic. It's very good because you're giving a sight and a new terms of a blue ocean strategies. That's very amazing that you already adhere that it's not only a matter of a state, a matter of a team or individual, but it's only a system problem disaster that hopefully we can also contribute not only how to organize, but also how to make a change or an agent of change in our capability. Thank you very much. I would kindly ask you to wait for a question and answer session that will be held after the third speaker presentation, Dr. Prajit Kaur Singh. And for all participants, I remind you, if you have got some question for our speaker, you may use the chat features in the Zoom applications. And then the question will be addressed in the question and answer sessions. Now, I would like to welcome our second speaker, Dr. Emma Camelia, who will be delivering speech with the title, Promotive and Preventive Efforts for Patients at Risk of COVID-19 in the Healthcare Environment. Before we begin, may I briefly read our second speaker curriculum vitae. Okay, Dr. Emma Camelia, Dentist Master of Biomedic. She is a senior lecturer at Dental Health Study Program, and she's also a head of Center of Research and Community Services at Poltekkes Kemenkes Tasikmalaya. Her educational background, finishing her master's degree in basic medicine, specializing in psychology, faculty, and medicine, University of Indonesia, and gaining her doctorate degree in medicine, faculty medicine, Hasanuddin University at 2018. Her publication, she already have 26 journal articles in 2020-2021 and 5 intellectual properties rights so far. Okay, her training, her recent training is on vaccinator training participant during COVID-19 vaccination procedure for vaccinator in healthcare facilities. Her research started with the anti-inflammation activity test of yellow banana fruit extract, Musa paradiasical 1, in Caragen-induced blister white rats in 2019. And then in 2020, she's checking the correlation of ergonomic of risk factor with carpal tunnel syndrome, CTS, in dentists in Tasikmalaya City. And the latest one is a simple ventilator as emergency assistant in patient with light to moderate shaping difficulties during the pandemic COVID-19 in 2021. Welcome to ICET 2021, Dr. Emma. Ladies and gentlemen, I would like to invite Dr. Emma Camelia to these sessions. Dr. Emma Camelia, the stage is yours.
Thank you, Ms. Sinar Pertiwi. Hi, hello, good morning, ladies and gentlemen. Greeting from Indonesia. Thank you for each one of you for being here today at this wonderful occasion. Let me introduce myself. My name is Emma Camelia. I'm from Health Polytechnic West Java, Indonesia, and I'm from Health and Disaster Emergency HD Center, Center of Excellence, Tasikmalaya, Indonesia. I am author of this paper, and this paper title is Promotive and Preventive Efforts for Patients at Risk of COVID-19 in the Healthcare Environment. And this article was presented on International Conference on Health Education and Technology Tasikmalaya Health Polytechnic, or ICET 2021. So let's get started. Okay, have you seen my PowerPoint? Yes, okay. COVID-19, severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2, a new virus in human causing respiratory illness, and the COVID-19 was identified in Wuhan, China in December 2018, on 11 March 2020, and by September 2021, almost 2 years after COVID-19 was first identified, there had been more than 100 million confirmed cases and over 4.6 million lives lost to the disease. Next. Okay, can you see my PowerPoint? As you can see on the screen, here is the history of COVID-19 from December 2019 to April 2021. Next. And then new variant change of the course of the pandemic. The Lambda variant was first discovered in Peru in August of 2020, and the Alpha variant was first identified in UK in September 2020, and the Delta variant, it was first discovered in India in October 2020, and the Beta variant on December 2020 was first detected in South Africa, and the Gamma variant was detected in Tokyo on 2020, and the last Omicron as a variant of concern, VOC, on November 2020. The next. What is the transmission of COVID-19? Primarily transmitted from person to person through respiratory droplet with sneezes, cough, or talk. The mouth of noses of people who are nearby or possibly be inhaled into the lung, a physical distance of at least 1 meter from touching hand, object, or surface with droplets, and then touching their eyes, nose, or mouth. Next. There are symptoms of COVID-19, fever or chill, cough, shortness of breath or difficulty breathing, fatigue, headache, nasal congestion or runny nose, muscle or body aches, short throat, new loss of smell of taste, nausea or vomiting, and diarrhea. Next. And the coronavirus risk travel by activity, this number 1 is playing tennis and getting takeout from a restaurant. And the last, number 9, bar or large music concert. Next. Who is at high risk of being exposed to COVID-19? The risk of severe disease increases steadily as people age with underlying medical condition, including but not limited to heart disease, diabetes, or lung disease. The older males with comorbidities such as chronic disease, including cardiovascular and cerebrovascular disease, endocrine system disease, digestive system disease, respiratory system disease, malignant tumors, and nervous system disease. And the next. How about the vaccine COVID-19? Early vaccine development, the first clinical study of vaccine designed by the Vaccine Research Center at the National Institute of Health USA and by the US pharmaceutical and biotechnology company from Moderna. Next. How about effective are the COVID-19 vaccine? The highest from Pfizer and BioNTech, and the lowest from CoronaVac and Sinovac at 50%. Next. Okay, the 5 IPC or infection prevention and control strategies required to prevent or limit transmission of COVID-19 in healthcare facilities. There are 5 numbers. The first, screening and triage for early recognition of patients with suspected COVID-19 and rapid implementation of source control measures. 2, applying standard precaution for all patients. 3, implementing additional precaution, isolation and cohorting of patients with suspected or confirmed COVID-19, contact, droplet, and airborne precaution. And implementing administrative control to health workers and manage visitors, and implementing environment and engineering control. Next. Okay, number 1, screening and triage. For screening and triage, isolation room, waiting area where masks positioned at least 1 meter apart from each other in designated, well-ventilated waiting area, and trained staff of the sign and symptom of COVID-19. Next. What about isolation or designated waiting area? This area should have benches, stools, or chairs placed at least 1 meter apart, and the designated area should have dedicated toilet and hygiene station and trash bins with lid for disposal or paper tissue used for respiratory hygiene or after hand washing, and must display graphic information for patient. Healthcare facility must pay attention to the following. The 1, encourage health workers to look out for potential COVID-19 cases, encourage rapid testing and reporting of patients with suspected, and establish reminder system to clinicians to consider COVID-19. Next. Applying standard precaution for all patients. To reduce the risk of transmission of bloodborne and other pathogens, and the basic level of infection control precaution that should be used at all times in the care of all patients. Hand and respiratory hygiene, the use of appropriate PPE or personal protective equipment according to risk assessment, environment cleaning, and safe waste management. Next. And for high hygiene, before touching a patient, before any clean or aseptic procedure is performed, after exposure to body fluid, after touching a patient, and after touching a patient surrounding, cleansing hand with an alcohol-based hand rub containing at least 70% alcohol or with soap, water, and disposable towel, and alcohol-based hand rub product are preferred if hands are not visible. Shirt and use the appropriate technique and duration for performing hand washing or hand rubbing. Next. For the respiratory hygiene, display graphic information on the need to cover nose and mouth with a tissue of brain, elbow when coughing or sneezing. Perform hand hygiene after contact with respiratory secretion or object that may be potential contaminated with respiratory secretion, and give patient with suspected COVID-19 a medical mask to wear. Next. How about use of PPE, personal protective equipment? Start training on putting on, removing PPE from access to sufficient supplies, appropriate hand hygiene, health worker compliance, regular monitoring and feedback by IPC. Next. For environmental cleaning, cleaning and disinfection procedures are followed consistently and correctly. All surfaces in healthcare facilities should be routinely cleaned and disinfected, especially high-touch surfaces. To clean environmental, clean surface thoroughly with water and detergent, and apply a disinfectant solution for COVID-19. Either 0.1% sodium hypochlorite or 70-80% ethanol are effective. Contact time of a minimum of 1 minute is recommended for ethanol, chlorine-based product, and hydrogen peroxide. And the last, after appropriate contact time, disinfectant residue may be rinsed off with clean water if required. For waste management, use appropriate PPE. You can use boots, long sleeve gown, heavy duty gloves, mask, or goggles or face shield, and prepare for increases in the volume of infectious wasp during the COVID-19 outbreak, especially through the use of PPE. Implementing additional isolation and cohorting of patients with suspected or confirmed COVID-19, and contact and droplet precaution, and airborne precaution. Contact and droplet precaution. For perform hand hygiene, you can use medical mask, eye protection, or goggles, or facial protection, face shield to avoid contamination of mucous membrane, clean, non-sterile, long-sleeve gown, and medical glove. The health workers and caregivers working in clinical areas should continuously wear a medical mask during or routine activities throughout the entire shift. Administrative measures related to health worker, monitoring health worker compliance with standard precaution and providing mechanism, and established an active syndrome surveillance of health worker at the facilities entrance. Next. And the last, implementing environment and engineering control. Ventilation rate, the amount and quality of outdoor air provided into the space, and airflow direction, the overall airflow direction in a building and between space should be from clean to clean zone. Air distribution or airflow pattern, the supply of air that should be delivered to each part of the space to improve dilution and removal of airborne pollutants generated the space. Ultraviolet germicidal irradiation UVG, it's effective in preventing respiratory pathogen transmission in healthcare facilities and may be absorbed by the outer surfaces of the eyes and skin, leading to keratoconjunctivitis and dermatosis. And spatial separation and physical barrier at least 1 meter should be maintained between patient and help to reduce the spread of many pathogens in the healthcare facilities. Use of physical barriers such as glass or plastic windows. This approach can be implemented in the areas of healthcare facilities where patients first present, such as screening and triage area, registration desk at the emergency department, or at the pharmacy window where medication is collected. Okay, and the last my PowerPoint. This is my conclusion. Consider alternative to face outpatient visit using telemedicine, a telephone consultation or cell phone video conference to provide clinical support without direct contact with the patient, and screening, early recognition and isolation of patients with suspected COVID-19, emphasis of hand hygiene, respiratory hygiene, and medical masks to be used by patients with respiratory symptoms, and appropriate use of contact and droplet precaution when performing clinical exam on patients with suspected COVID-19, and prioritization of care of symptomatic patients. When symptomatic patients are required to wait, ensure they have separate waiting area where patient can sit at least 1 meter apart, and provide them with masks. Educated patients and families about the early recognition of symptoms, basic precautions to be used, and which health care facilities they should refer to if any family members shows sign of COVID-19. All right, that is the presentation of material from me, and thank you for your attention. I'm waiting for discussion of question from all of you. Assalamualaikum warahmatullahi wabarakatuh.
Health promotion and prevention prokes in pandemic era. Okay, I would like to say to Ms. Lee, Dr. Lee, are you already in the Zoom venue? Okay, since our third speaker hasn't joined us in the Zoom venue, I would like to ask Dr. Perjit Kaur and Dr. Emma Camelia Mbiomed to answer several questions. So we are going ahead to the question and answer session. Is that okay, Dr. Perjit Kaur? Okay, I would ask Dr. Emma Camelia to come in front to join, since you're already in here. Okay. Okay. Pardon? Siapa? Oh, okay. I'm sorry. Okay. Pardon? Can I call again? Sorry to again. Okay. Finally. Dr. Lee, are you there? Can you hear my voice?
I can hear your voice.
Oh, okay, just in time.
Can you hear me?
Yes.
Oh, I've been here actually, but I had a technological problem.
Okay, that's right. I'm looking for you, and we're going to fast forward to the question and answer, but thank you very much for your coming. Dr. Lee, now we start again. I'm sorry, Dr. Prajit, we are back to the first schedules. Now I would like to welcome our third speaker, Dr. Lee Burrows, who will be delivering speech with the title Integrated Emergency Education, Creating Calmer Classroom. Before we begin, may I briefly read our third speaker curriculum vitae? Operator, please. Dr. Lee Burrows, a senior lecturer in the College of Education, Psychology and Social Work at Flinders University, Australia. Her education background She got Diploma of Solution Focused Counseling at Sonia Institute, Tasmania, 2011. And then for her PhD at University of South Australia in 2011 too. She got plenty of grants and fellowships, and since 2015, she got fellow the Torrance Resilience Institute, Adelaide. And then in 2016, Dr. Lee got the faculty research grant for research into mindfulness in the United States. And then the recent one, she got outside studies program, sabbatical semester 1 in Flinders University. Her publications, I got like plenty of books published in the very reputable journal, and her latest one is in Fresh Empowering Mindfulness for Women at Routledge one. And book chapter in 2014, Rural Spirituality at Work, the contribution of mindfulness to personal and workforce development in Roger Harris and Tom Short. Awards, Dr. Lee Burrows got the Faculty Teaching Award recipient in 2012 for teaching excellence in developing a relational pedagogy for free and in-service teacher education. And in 2016, Vice Chancellor's Teaching Award for pioneering mindfulness in free, in-service and postgraduate teacher education in 2016. Okay, welcome to ECHAT 2021, Dr. Lee Burrows. For today's session, I would like to give time and place for your presentation, Dr. Lee Burrows. Once again, welcome to the Zoom panel for today.
Thank you very much. I'm sorry I was not able to upload the background, so you're seeing me in my office at Flinders today on Saturday with a mindfulness tree behind me. In my office. So what I would like to do today, I thought it might be interesting to share with you some of my case study research into a postgraduate and undergraduate topic I created at my university called Creating Calmer Classrooms, which is a trauma-sensitive topic that also includes, has great relevance to emergency education. So I'd like to share my screen with you. Hopefully that is going to work. I'm not sure if I'm going to be able to do that actually. So I might just speak to my presentation and you'll have a copy of the slides afterwards. So my background is quite integral to this work because I've been a domestic violence worker in a women's refuge. I've been a primary teacher, secondary teacher. I've done an expressive therapies training and a solution-focused training. And I've been a statewide wellbeing project officer and a university lecturer and researcher. And everything really has come together for me in terms of wellbeing and trauma-sensitive practice and mindfulness, which, as I said, links beautifully with emergency education. The key factor seems to be with emergency education that we bring safety. The speakers so far, I think they have highlighted the importance of safety, that this is actually very important so that we make sure we connect with children and we provide a very safe environment for them to be in. So this doesn't seem to, whatever the emergency situation, safety seems to be paramount. And so we don't spend too much time necessarily talking with children, but we work through activities. And this is a lovely way, I think previous speakers have spoken about the importance of a global approach. And I think this is a lovely way that people can work together across countries without having to rely so heavily on spoken language.
Dr. Lee, I've got your PowerPoint. Yes, I'm setting. Okay, you can guide me in which slide.
That's lovely, thank you.
No worries.
So I might now go to this one. Can you scroll through for me now to, because I don't think I can move them.
Please remove the window. Sorry. Which
Can you
slide?
scroll through for me? Ah, yes, beautiful. Can you go to 2 more slides?
Oh, wait. I'm sorry.
Thank you. You're doing a great job to help me.
Wait. Okay. Oh, we cannot open.
If you go to slideshow at the top.
Okay, I know. It's wait. It says.
If you go over to the top to slideshow.
Okay, this one I try.
Yeah, and just next, yeah, keep going. That will be good. Thank you. Next
Yes,
one.
Please move this window away from the shared application. I'm sorry, I'm having trouble in it for a while.
I had trouble. I've got my PowerPoint here. If I can try and can you see that? Are you able to see my slides?
No, ini.
Can you see my slides now?
Number Pak, slide number what? Oh, laptopnya nggak bisa.
Yeah, okay.
Lihat di sini.
Okay. Yes. I'm sorry, I think there's a problem with my laptop, so I cannot open in the big screen. So I will be make it a little bit bigger like this one, and you can guide me in which.
All right then, thank you.
Okay. So you start with this one or with the first?
So if you keep going about 3 more slides down.
Okay. This one?
Keep going. Yeah, 1 more. Okay, we'll start from here. Thank you very much. So I was speaking before about the importance of when we're working with children in emergency education, they often need non-verbal means of expression. So that's why we use games and artistic activities and paintings so that the experience of trauma can be released very naturally without confronting the person, which can actually create further trauma. So the next slide, please. Thank you. So given my work and my research into trauma-sensitive practice, I decided to create this topic at my university called Creating Calmer Classrooms, a trauma-sensitive approach. And I've given you some links there if you're interested in looking up these topics. I have had some wonderful students from Indonesia and Malaysia joining me in these topics, and from all over the world, and from all the different states in Australia. And you can see there some of my wonderful students and some of the activities that we do. And in the first picture there, that's just outside my faculty office. So if you could go to the next slide, please. So in this course, out of the research literature and my own research, I was mentioning before about safety, the importance of safety. So what we do is we make sure we start in phase 1 with safety and stabilisation and initial relational engagement. So that's making sure the environment's very safe. We're focusing on stabilising and grounding the child. And we're making some initial very gentle relational connections. Much like the first speaker, the 2 speakers ago that I heard talking about, she was mentioning the importance of a proactive approach, a preventative approach, and that focus on care. So only then when we have that stability and we have that safety, then we can move into some activities and some processes that can help to organically dissolve some of the trauma. Without necessarily needing to dig in really deep and talk, which can make people feel worse. And the final phases are really about, it's not only the client or the patient or the student's well-being, but it's our own self-care. This is becoming increasingly important in the literature. I'm not sure how much research has been done in your country about this, but the importance of self-care and self-compassion, because related or nuclear, explosions or whatever, fires, floods, whatever it is, we can become traumatised ourselves through working with others who have experienced trauma. It's called vicarious trauma, and so we have to make sure that we're really looking after ourselves as well. The next slide, please. This is a very beautiful activity that some of you might like to try, that's so calming and so inclusive. So I just simply ask the participants in my workshops to each paint a tree. And then we put all the trees up on the wall of the classroom, and we say now we have a forest of trees. So everyone is unique, as you can see, but we are together in our diversity, which is a very beautiful thing. Next slide. So we can do some interesting work around ensuring safety. This is a beautiful picture from a kindergarten child who drew where she felt safe at kindy, where he felt safe at kindy. And he said, I feel safe when I'm inside if it's raining and there's thunder. And so in the picture diagnosis literature, we talk about the house being our body. And so this is how we can feel very, very safe. If students can feel very safe, and the clients, if we create a safe atmosphere. Next slide. We would have to be careful now that we have COVID with perhaps not sitting quite so close, but these beautiful children, here they are sitting in a circle, and we're creating that ritual, that safety, which of course many religions do and many communities do. You would have many beautiful, rich cultural expressions of community. And this is what gets disrupted in any kind of trauma event, whether it's to do with illness or disaster. Everything gets disrupted. And so we need to come back and create that really safe environment again. Next slide. So we can do this in a variety of artistic ways, making a beautiful orb with a handful of clay, making a bird, sculpting a house can really encourage a feeling of being safe and at home. Next slide. Relationships are incredibly important. Some literature from Germany talks about positive relationship experiences are perhaps the essential input. Relationships give a child a feeling of safety and acceptance. And I love this expression from Kuhn, that we can become a safety commissioner for the child. And I think if we work in any field really, with any age person, we can be a safety commissioner, whether it's an elderly person, with COVID, who we are something like their protector while they're in a very vulnerable situation. Next slide. This, in Australia, in Melbourne, there is a very fascinating dentist. I think we've heard from someone who has a dentistry qualification today. She works specially with very vulnerable patients who have experienced trauma, and she trains dentists in trauma-sensitive practice. And she really gets to know her clients. And with one particular client, this client refused to open her mouth and to have an examination or any treatment until the dentist found out that her patient loved the singer Madonna. I don't know if you know Madonna, very famous American singer. May or may not like her, but the important thing is, I think, that the dentist tuned in to her patient's love of Madonna. And this dentist actually is very musical and sings and dances. And so she sings and dances to Madonna as she treats her patient. And she does some very powerful work with patients who've experienced sexual abuse, have fears, other kinds of abuse and trauma. So she's able to help them relax in their treatment. Next slide, please. There's a lovely Australian resource available at this link that's very accessible, and it talks about understanding the experience of the abused and neglected child, assists us to develop compassion, patience and empathy. It's a key intervention in itself. And I think sometimes, you know, we think we have to have a lot of knowledge, but really coming from a place of compassion, patience and empathy, that's going to take us a long way. And I guess having compassion and patience and empathy for ourselves as well. Next slide, please. I might go on to the next one actually, because I want to make sure we have enough time. So next slide. This is some very fascinating work here from Bernd Ruff, and you know, that's worth definitely looking into this book and the work of Ruff in emergency education. Very powerful work from Germany. And he talks a lot about the effect of trauma on the hemispheres of the brain and how it actually disrupts the communication between the two hemispheres. And so consequently, this is the value of doing the movement work, the creativity, the artwork, because we're actually joining up the two hemispheres again. And it's a very easy and natural way to work. Next slide. This butterfly hug is a very lovely thing to do, and you might like to try it now. I invite you to put your hands in front of your chest if you would like to, and you can join your thumbs together if you wish, or just cross your hands, and you, in a butterfly hug, you pat from side to side, just in a rhythm that you're comfortable with. And so whenever you're feeling a little bit stressed or anxious about something, it could be a conference presentation, or you're working with somebody from a trauma background who is feeling very stressed, you can do this activity. It's a very safe activity and a very calming activity. And many of my students are writing to me and telling me that they are using this with themselves in their practice, and they're also using it with their clients, their patients and their students. And this method was actually born in a mass disaster setting in 1998 in the aftermath of Hurricane Pauline, when some therapists wanted to be able to leave behind something very simple and something very accessible that the people could do themselves when the volunteers and the experts left. And I think we really do need some very simple things like this that are for both ourselves and for others. Thank you. Next slide. Next slide. Thank you. And the next one. Yes, we'll go on to the next one as well now. Straight to the next one. Thank you. So in this approach, we're really wanting to give time for the natural and organic processing of emotions, and something like the butterfly hug can be very helpful with that. Adults really need to allow for the expression of children's emotions. Sometimes with children, we want to reprimand them, we want to tell them what's appropriate and not appropriate. But when a child has been through a trauma background, a traumatic experience, we need to really honour their feelings and be interested in them and support the child in processing them. Sometimes the way we have been brought up, we are not comfortable with our own emotions and we stifle them. But it's a very important part of healing that we be in touch with our feelings and be able to express them. Next slide, please. This is very much, I'm sorry, you can't see the picture here, of some children in Nepal. doing some drawing. Through the non-verbal means of expression, children can express themselves without speaking, and they can also kind of have a bit of distance from what they've experienced. Next slide. This is a key, one of the speakers before talked about key takeaways. I think this is something that's very, very important. In this approach, it's therapeutic, but it's not therapy. So you don't actually have to be a therapist, and you're not digging really deep into trauma when you're performing emergency pedagogy or trauma pedagogy. You're being therapeutic. You're helping the person naturally dissolve their trauma and naturally let go, rather than having a heavy clinical intervention when that's appropriate for qualified people. Next slide. Sand tray is something you might have heard of. You can simply have a lovely container of fresh white sand and a whole lot of little figurines like they have here. And the child just chooses the things that they want to play with. And the child knows what's important for them. They know what they want to process. If we can sit back and allow them, they'll enact a little game. Quite often children who've been involved in disasters or emergencies, there's been a death in the family, an accident, they will enact that in their play. And through enacting that, it's a healing process, and they are in charge of it. And we are there, like in this lovely picture where the woman's just listening and being present, but she's not analysing. She's allowing the child to process themselves. Next slide. Movement work can be very much the same. It can free us up from being stuck and paralysed, adults and children, jumping, clapping, skipping, juggling, singing, dancing, all these things get the children's bodies back into balance and really help our work. Next slide. Painting. Yes, painting, I've already mentioned painting. That can be a lovely way to very organically let go. The next slide. Using modelling wax, I had a lovely picture here that you can't see from a really delightful Malaysian student of mine who made some beautiful figures out of wax. The next slide. Storytelling. We might just keep going through so that we meet the time. Next slide. Next slide, please. And this last phase, I want to really, make sure it's another key takeaway, the importance of self-care for us. Next slide. Nothing much is coming up in that one. Try this one. Yes, attending to the needs of the helpers is incredibly important. We can finish off here. Attending to the needs of the helpers, we can sometimes be, have compassion fatigue, vicarious trauma. Really important to look after ourselves, to take some time, to slow down, make sure we access help when we need it, and really engage in self-reflection as well, to take care of ourselves. Something like the butterfly hug can be just so helpful in looking after ourselves and helping us when we feel stressed and we need some grounding. And the beautiful thing is that our own calmness will be transmitted to the child or the person that we're working with, because if we're really stressed, that will also be communicated to the child. Helpers need to be stable, centred and calm. Thank you very much. I've really enjoyed hearing what I've heard so far, and I'm sorry about the technical difficulties, but you get to see a little bit of my office there in the background. Thank you.
Okay, thank you very much for your valuable time, and it's a very interesting topic, Dr. Leif Burrows. while the first speaker talked about the shipment from planning disaster management into to be a leadership one, and second one in how the pandemic one still occurring in our countries, and then you implement and complement all with the post-traumatic, which is very interesting. Thank you very much, Dr. Liberos. I do apologize too for the slides. I'm sorry for that. Ladies and gentlemen, now we come to the question and answer session. It will be held for about 30 minutes. Some of you have already submitted your questions. And I already have some question for Dr. Bridget. If I'm not mistaken, you've got 3 questions. Have you received it, Dr. Bridget? Would you like to answer first questions and second and third?
Yeah. Thank you, Wahyuni. Wahyuni is asking about what is the purpose of disaster management, which is a very important question. I think Wahyuni really went deep and thought actually, the basics of disaster management, which probably I've failed to present in the earlier of the presentation. 20 minutes, not really adequate time to go through, but yes. Let me answer that. So usually disaster management itself, we have 2 separate components. One is the preparedness, that is before the disaster actually happened, right? So how well are we prepared for the disaster? And the second component would be after a disaster occurs. What do we do? I mean, in terms of how do we manage that, how we can best allocate our resources, how many lives can we save, and how we can do the rehabilitation and the recovery part. And of course, then we also talk about the preventive and the mitigation part, right? So yes, it is something before, what we do before the disaster, then what do we do after the disaster, right? So the purpose of disaster management is to be prepared and to manage well. Did I answer your question, Wahyuni? Did I answer your question? Yes? I hope I answered. I'm not sure.
Okay, yes, Ms. Wahyuni is actually on the chat, so she already has understand your answer, Ms. Bridget. Probably the second one, because you can see from the chat there are 3 questions for you.
Right, and this is Ismail Muhammad, and he's asking, what is the difference between proactive and reactive disaster management? Yes, proactive is something that we should expect before it happens, even before it happens. So reactive is I'm only reacting when it happens. So which is better? Something we are prepared and we expect that to happen and we are so well prepared, or we act when the disaster happens? Definitely it's something we should be prepared for that, right? So in proactive management, we have a lot of strategies where we can be proactive. For example, it depends in which situation you are, where are you managing. It depends if you're in a hospital or you're in a big corporate, organizing the whole thing. Now, one of the example I would like to use is that I worked before in early warning score. Now, early warning score is a system. I'm just giving an example, right? It's a system where we take the blood pressure, vital sign, and respiration of the patient. It's a machine, a blood pressure machine, and it's a small device. Now we put it on the patient. It's an electronic early warning scoring system where it detects if this patient is deteriorating early, right? So based on the patient's respiration and heart rate, Now, the whole system, the machine can send signal to the system, and it sends signal to the team. And we have a team in the hospital who we train for it, who will come in response without even us trying to, as a nurses, without us having to go and check on the patient and, calling the doctor. And it's very intimidating to call doctors, right? So sometimes they can go like, why are you calling me at this hour, right? So we really have certain team that we train. Maybe they are from ICU, emergency, and they can come and check on the patient and give some early treatment, like give an oxygen or IV to help us manage the patient when we are in the ward, for example. So this is a example of a system where we can incorporate as a proactive way. That means before this patient collapse, I have a system in place using certain technology. Maybe most of our proactive system, usually we use a lot of technology, but when we don't have technology, we can use certain tool, like I was talking about risk assessment. We go around and check what is wrong in the ward, for example. Is the wires hanging there? Is the place safe? Are we providing safe environments, for example? So this is being proactive. So being proactive is said to be more superior to react when something happens, because it's just like we see patients fall every day, and if there's too many falls, okay, today the patient falls, tomorrow the patient falls, next day the patient falls, and we keep on managing the fall. Now we treating the patient after the fall. It's not as good as we find out why the patient is falling and prevent that from happening altogether. We create systems, we train our personnel to react to the situation before even it happened. That means we do risk assessment. We find out who are at risk of falling, and we take care of that. We make sure the call bell, for example, we make sure that we have system in place to assist this patient from falling. Right? So this is what I meant by being reactive as opposed to being proactive. Yeah, the difference. Did I answer your question? Right. I think the third question is from Tanzania, the importance of disaster management. Now, yes, disaster management is very important, because if it happens, it really drain off all our resources, right? We are overwhelmed with the situation. We have only so many nurses. We only have so much of resources, which we use to manage on our daily activities. And it's an impact on the family, it's an impact on the staff, it's an impact on the whole system. So if we do not pay attention to the management of this disaster, then really we're going to make everyone, everyone going to have burnout, and we all will run to Dr. Lin to say, help me, I'm burnout, I have mental health issues, right? Yeah, so that is very important to be well managed. So we know what to do, we know what to incorporate, right? So I hope I answered your question. Was it that?
Yes, thank you. Yeah.
Zani,
yes.
Zani.
Thank you, Dr. Prajit, for your answer to the three questions. Before that, because we have a time constraint, we will move to Dr. Emma first. If we have spare time, and there's probably one question again left for you, Dr. Prajit. Okay. Dr. Emma, because here there are 3 questions for you. It's come from, first one from Pajar. As you said before, that people who have experienced trauma often can't talk about their experiences. So how to stimulate them and make them can talk about their, I'm sorry. Okay, I'm sorry. I do apologize that for Dr. Lee, I'm sorry. It's come from Hendianto. In my area, there is a stigma in civilian. Patient that being isolated from COVID is like patient that were abandoned and have to survive themselves. What do you think about that? So this is probably in Indonesia, Dr. Lee, Dr. Prajit, so the stigma is still high. So sometimes when you are having the symptoms of COVID-19, it's better for the family to keep the person and not going to the health center because they're afraid of the stigma from the society. They're being left alone or being prejudiced that they will die in the place of the health services. Probably Bu Em.
Okay. The question from Mr. Hendrianto, is that?
Yes,
true?
that's super.
Okay. Ms. Hendrianto, thank you very much for your question. The experiences of healthcare worker during the COVID pandemic are not unprecedented. The deaths that arose from previous pandemic and epidemic were remarkable, resonant with what we are hearing about the impact to COVID-19 globally pandemic in the world. We have an opportunity to learn from the lesson of previous crises, mitigated the negative mental health impact of COVID-19 and support the longer-term well-being of the healthcare workforce in the worldwide. COVID-19 patients aware of the severity of the pandemic were very adaptable to the situation and had full confidence in health professionals. Patient isolation was perceived necessary. Technology has helped to maintain this important to communication between patient and relatives. Okay.
Hopefully, Mr. Hendrianto. So the key is about the communication, how we communicate and educated all the surrounding or the community. Is that right? Okay. Probably for the second one is from Taminur Apipa. So how long does the virus last on your hands before we wash it with hand sanitizers?
Okay. Thank you, Ms. Dinar, and thank you for your question, Ms. Taminur Afifa. There has been a lot of how COVID-19 is spread through the air via droplets and aerosol, but no study is replacing the continued importance of hand wash toward the beginning of the pandemic. A study showed at the SARS-CoV-2 virus can survive on the cardboard for as long as 24 hours and on stainless steel for about 72 hours. It highlighted the importance of cleaning surfaces that may have become significantly contamination. We know that SARS-CoV-2 can be spread through droplet and aerosol, but you can also become infected by touching and contaminated surfaces and touching parts of your face. Is that?
Yes. Okay. Thank you very much. So it's already answered for The second question from Tamino Apipa, so they have time for the virus to lessen our hands and for the air too. For the third one is about the Omicron COVID-19. It's entered Indonesia too. And we all know that now is the end of the year. We got like several occasion like for Christmas and then long end years. How about the probability, how to prevent it? Because Indonesia is just like easy, like a family gathering thing. So when there's a Christmas and there's an end years, people like to go to their family. So is there any suggestion how to prevent from the new COVID-19 virus?
Okay. The new COVID-19, namely is Omicron. Omicron on November 2020, a new variant of SARS-CoV-2 was reported to the WHO. This new variant was first detected in specimen collected on November 11, 2021 in Botswana. And on November 2021 in South Africa. Okay. On November 2021, who named the B1.1.528 Omicron and classification it as a variant of concern or VOC. Epidemiologist from Griffith University, Mr. Diki Budiman, Omicron is Indonesian, and Omicron believes it has entered Indonesia. We must be careful in dealing with it, including such as screening, early recognition, and isolation of patients with suspected COVID-19. Emphasis on hand hygiene, respiratory hygiene, and medical mask. This is important, medical mask, to be used by patients with all respiratory symptoms, and appropriate use of contact and droplet precaution when performing clinical exam on patients with suspected COVID-19, and prioritization of care symptomatic patients. When symptomatic patients are required to wait, ensure they have a separate waiting area where patients can sit at least 1 meter apart and provide them with masks. That's important. Educate patients and family about the early recognition of symptoms, basic precaution to be used, and which healthcare facility they should refer to if any family member shows sign of COVID-19. Okay.
Okay, thank you very much, Dr. Emma. The next one for Dr. Liveros. I would like to give you first question, probably it's not from the third one. I think it's very interesting. It's from Rita Rahayu, Dr. Lee. I'm interested in the material about butterfly hug, so that's similar like me. Butterfly hugs. What I want to ask is whether this butterfly hug is a therapy for those who have experienced trauma or can also be used on patients with mental disorder. Thank you. That's from Rita, Dr. Lee. Your voice, I can't hear you. Okay, thank you.
Thank you. It's lovely to have a question about the butterfly hug because that's a bit of a favourite of mine. Yes, it's an activity that we can really do no matter what we're experiencing because it's very calming. So for anyone with any kind of emotional, psychological, doesn't have to just be trauma, it can be people who have difficulties with excessive thinking. So I was mentioning before about integrating the left and right hemisphere of the brain. This is an activity that does that because we're crossing over the body. So for people who have obsessive thinking, obsessive feeling, they're very reactive or they're underreactive. The butterfly hug, mainly the beautiful thing about it is that it's very calming and it's very balancing and harmonising. So it's something that I think we would practice ourselves and we would start to feel the benefits of it ourselves, and then that's when we would extend it to others, rather than, you know, there's been some interesting studies that talk about professionals recommending activities for their clients and patients and students, but they haven't actually really tried them themselves. And I think it's best to always kind of know what you're doing and to have some experience.
Okay, thank you, Rita. That's the answer. We'll move on to Pazar. Dr. Lee, if you see the
yes,
question.
Was that the one about the...
Number one, I think.
About trauma, people who don't want to talk about their experiences.
Yes,
that's
right.
a really good question too. If people don't want to talk about their experiences, there's generally a good reason for that, and there's a self-protective mechanism in place. It's really, we've moved on now in the trauma field to, we no longer feel people necessarily have to talk about their experience. We now see that that experience can be processed in many different ways, through art, through movement, through storytelling, conversation, singing, music. And as I shared in the example with Santray, the child actually is speaking in a sense about their experience, but they're doing it through the vehicle of the little characters, or it can often be done through puppetry. So you and the child have a puppet, or you and the adult have a puppet, and the puppet says things about the puppet's had some traumatic experiences perhaps. And this is much easier than dealing with very confronting, painful information. It allows it just to be processed much more naturally and organically, because there is a risk of creating further trauma through the therapy that we take. Sometimes it's better just to take it a little more slowly.
Okay, thank you. So it's in conjunction with Nurul question, the second question about hypnotherapy. Yes. So many ways that we can use to really help people with the trauma one. So the last one, I think the number 3 from Ramadanti is actually can be a question for education, emergency education. What it means is that is it really we can do like 50 or 30% in pre-disaster or disaster or the post-disaster one. So when we start the education one, especially for 2 ways, for us as the health provider and for the community. So what's your suggestion?
I think it's a really good question too. I think the sooner the better. Okay. Because there's a chance if we actually, you know, with my colleague has spoken about importance of a proactive approach. I think the more we get in as soon as we can in these really natural ways, the more chance there is that there'll be some kind of organic processing and dissolving and letting go really early before things start to set and become hardened and much more difficult to lodge. If we think of our own experience, if we've experienced a trauma when we were 3 years old, say, and we're now 50, well, that is going to take much more processing and getting in touch with than if we meet a little child at 3 and they can creatively play through their early experiences, which are much fresher and they're much more likely to be let go of. But at the same time, we can use this approach straight after, further down the track, and a long way later, and it will still be very effective.
Okay, thank you very much. Okay, because we have a limited of time, our speakers, I will send the rest of the questions to your emails if it's okay, because there are plenty of questions too from the registration, so it's not an open in the video at the Zoom one. I will send all the rest of the questions to the third speakers, and I would like to say thank you for all the speakers for answering the question and for the great presentations. It was a pleasure to have you all with us today. And ladies and gentlemen, we have almost reached to the end of this session. Now, on behalf of the International Conference Committee, I'd like to say thank you to Dr. Perjit Kaur Singh from Malaysia. And thank you to also Dr. Lee Burrows from Flinders University and Dr. Emma Camelia from Indonesia for sharing your expertise and experience with us. As a token of our appreciation to our guest speaker for their time and their valuable contribution, may I request to our first Vice Director of Poltekkes Kemenkes Tasikmalaya, who is here today, Dr. Iwan Somantri, to give a present of certificate for the speaker. Okay. Saya keluar dulu atau enggak mau saya?
Okay. Dr. Perjit, hello, Dr. Emma, Dr. Leis, thank you very much for your participation in this conference. And here are the certificates as speakers for all of you. Okay, first, this for Dr. Perjit, this your certificate as a speaker. Once again, thank you, Dr. Perjit.
Next one for Dr. Lee Burrows. May Mr. Iwan give the certificate.
And then this certificate is for Dr. Lee Burrows. Thank you very much for your participation in this conference. And here are your certificates. Once again, thank you, Dr. Lee.
Okay, the third one, Bu Emma. Okay, Bu Emma will be receiving it directly from the director. Thank you very much, Dr. Iwan. Okay, thank you very much. Before we end this session, I would like to summarize the topic for our speaker today. From the first speaker, we know that shifting from disaster planning is not very important. How we have to plan now into more proactive ways on how to prepare the disaster management. And this is really need leaderships in all sectors. From the second speaker, conclude that still many obstacles and we need to still prepare ourselves for various kind of COVID-19. But we wish, hopefully, that our society and our government will make some effort to prevent further spread for the new COVID-19 in Indonesia. And the third one from Dr. Lee is that after the stabilizations of the process from disaster management, we need positive relationship after the effect of the trauma. We need to be setting a new ways, new methods, especially in education, how we can be empathy, showing an empathy, showing our patience to those who are receiving a trauma. That's all hope. Again, Dr. Lee, say hello to my professor in Master of Health and International Development. I'm from the public health over there. Hopefully we can see you soon there. And then, ladies and gentlemen, the first session of the International Conference on Health, Education and Technology has come to an end. Thank you very much for your active participation, and I hope you enjoy our conference. And now I'm going to hand over to our Master of Ceremony, Ms. Kanita. Time is yours. Wassalamualaikum warahmatullahi wabarakatuh. Thank you once again.
Thank you, Mrs. Sinar. Dear ladies and gentlemen, the first session of plenary speech has come to an end, and we will begin the second session of the plenary speech. The second session will be moderated by Mrs. Ida Rosdiana, Master of Nursing, Medical Surgical Nursing Specialist. Before we begin the second session, allow me to read the CV of the moderator. As you can see on the screen, Mrs. Ida is currently one of the lecturers in nursing department at Poltekkes Kemenkes Tasikmalaya. She earned her master degree in Faculty of Nursing at University of Indonesia and Medical Surgical Nursing Specialist in Faculty of Nursing, University Indonesia. Without further ado, Mrs. Ida, time is yours.
Thank you, Ms. Kanita, for the introduction. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. Welcome to the second session of parallel session, the International Conference on Health, Education and Technology on the theme of interprofessional collaboration on resilience in health and disaster emergency. Thank you for joining us today. I hope you all are doing well and still exciting to continue today's international conference. My name is Ida Rosdiana. I am one of the lecturers at Poltekkes Kemenkes Tasikmalaya. It's a precious chance for me to be a moderator of this international conference event. To begin with, I'd like to remind all the audience some notes for this session. Today's session will broadcast live and it's being recorded to be available for post-conference archive. The participants are not allowed to turn on the microphone during the speaker presentation. Each speaker will be given 20 minutes maximum for delivering the presentation, and question and answer session will be held after all speakers delivering the presentation. It will take for about 30 minutes. The participant will have the opportunity to submit the question for today's speaker at any time during the presentation. You may use the chat feature in this Zoom webinar, or you can also submit the question by using the link that is provided by the committee. The committee will compile the question, and I will read them out loud as time permits. Ladies and gentlemen, in this session, we have three prominent speakers who will deliver interesting topics in the field of health and disaster emergency, health science, health education, and medical technology. Without further ado, let's start our session. Now, I would like to welcome our first speaker, Dr. Nur Rahman, Master of Science in Agriculture from Indonesia. Dr. Nur Rahman, are you there?
Okay, I'm ready.
Okay. How are you today, Doc?
I'm fine.
Yeah, Alhamdulillah. Okay, ladies and gentlemen, before Dr. Nur Rahman start the presentation, I will read his CV. Dr. Nur Rahman earned his doctoral degree from Institut Pertanian Bogor. He is currently working as senior lecturer at Poltekkes Kemenkes Malang, Indonesia. He has done his researches in his expertise as follows: about tacococc potential as anti-cancer in cancer cell lines and in experimental animal, and also about Gondomonas potential as an anti-proliferative of cancer cell. And his training experience is about standardized nutrition care guidelines, functional food for diabetes and cancer, and candidate. And his experience as a speaker about food formula for stunting, the role of food to prevent cancer, and in international conference, food anti-cancer. Today, Dr. Nur Rahman will be sharing his expert opinion about prospectus of food for cancer prevention and treatment. Okay, Dr. Nur Rahman, you have 20 minutes to deliver your presentation. Time is yours.
Thank you very much. This time I say thank you, the Honorable of Hajah Ani Rodiati, Sarjana Pendidikan Magister Kesehatan, and the second, the Honorable of Dirjen Nakes, Dr. Gigi Arianti Anaya, MKM, and now I will deliver of the perspective of food anti-cancer. Do you listen my speaker?
Yes.
Okay. I will share my share screen.
Yes, please.
Okay. Thank you. I will share. It's clear about the PPT?
Yes, we can see
okay.
Your slide.
Okay, I will continue. Okay, this is my materials about the perspective of food for cancer prevention and treatment, and especially the effect of tea and ice cream on CD444. Yeah, okay. Okay, next. Okay, 10.3. Okay, I will start until 11 o'clock. Yeah. Okay. Okay. I'm from Politeknik Kesehatan Malang. If you don't have go to Malang, this is Malang City. Is Jalan Ijen Street. This is the very good street. I mean, in Malang, and there is Malang produce apple fruit. Yeah, it's familiar, and there is it is the shop of ice cream and bakery, Tokoun. Yeah, Tokoun in the oldest shop in the Malang. Okay, and there is the food, many food in the Malang city. You can enjoy if you go to Malang. There is bakso Malang. Yeah, apple. And many other there is in Malang. We talk about food for cancer, anti-cancer. My mean, yeah, it's I think all diseases is designed by Allah Subhanahu Wa Taala. So every man must propose, but Allah will dispose. Allah will give every effort, so we just do it, and do it. So we must close to Allah, so we can get many diseases, especially in cancer. Outline of my presentation is about cancer, food perspective anti-cancer. This is my research, Solanum torfum, about the first research, and the mechanism of chemo prevention and chemotherapy, and the last is the effect of tea and ice cream takoka atau Solanum torfum on CD44. Really, I interest in cancer because cancer disease is also in the seldom in reduce, but always in many people make a cancer until 1930 until 2030. And about the mortality rate in the different in developed and developing country. In the developed country, the mortality rate is in the second, and in developing country, the rank is in the sixth number. And many treatment have introduced in the cancer disease. There is surgery, chemotherapy, radiation, and immunotherapy. But there is a diet, herb, and complementary. Yeah, it is the treatment of cancer. So that is the cancer statistic. In the red row is in the American or European, but in the yellow, the yellow row is it's many in the Asia, like in Singapore, Japan, China, and maybe in Korea, India. So it's why this matter. We can show maybe it's depend on the food consumption or lifestyle every people. Cancer in Indonesia, I think the offering of Indonesia is 1.4, but in Jawa Barat maybe under the average 1.0. It's the number of 23. And what is cancer? Cancer is a disease characterized by cell cycle abnormality. So they grow out of the control. They grow out of control like that, like this. The cell. This is a cancer or tumor. This is very full cell and not arranged. But if the normal cell is a good arranged, but tumor or cancer is very full like that. Why they cannot stop in the growing? You can see this pathophysiology. The key of the pathophysiology is there is mutation of genome. Really, it's from DNA, but if the DNA is mutasi, it will become cancer or tumor. But if the DNA may be the mix of failure, it can be repaired by enzyme, etc. But if the DNA have mutation, maybe it will become tumor or cancer diseases. It is the pathophysiology of cancer. And what is the DNA to make and mutasi? To make it, I think I have said that the make can be recognized by enzyme, so it can be correctly, but the mutation cannot be recognized by the enzyme. So they can, mutation, so they can produce cell not stop, growing and growing and growing like that. This is mutation. Mutation, there is different. I have cat, maybe I have rat. The difference is C and A. So it's cat, maybe it's normal, yeah. But I have rat, maybe that is mutation. So it's different C or rat, maybe it's make mutation like that. Maybe I want to have the explanation about the mutation. Maybe it is normal mutation, and maybe normal it is the mutation in the best DNA. And cancer, maybe cancer characteristics because every in the body in the people, really everyone have a natural killer cell. They can kill the cancer cell, but sometimes why man or person they produce or they have a cancer cell. Maybe the immune is not good because the natural killer cannot know about the cancer cell. There is cancer cell, but the natural killer not kill this cancer cell. So our immune must have a good immune. So they know normal cell or maybe cancer cell. It the about the apa ya? If they have a good immune, the cancer risk factor of the cancer risk factor, there are two, intrinsic factor and non-intrinsic factor. Maybe the non-intrinsic factor is there's two: endogenous risk factor and exogenous risk factor. And exogenous factor is maybe can modify it, but endogenous factor only partially modified. And what is the exogenous factor? Maybe radiation, chemical carcinogen, virus, maybe bad lifestyle, smoking, lack of exercise, nutrient imbalance. That's the exogenous risk factor. But endogenous risk factor maybe biological aging, genetic, DNA repair, machine, hormone, growth factor, like that. But the intrinsic factor is about the DNA replication. It cannot unmodified. Unmodified, yeah. It is the cancer risk factor. It is the last factor contributing the cancer risk. Maybe in the UK, it is tobacco is money risk to make a cancer. Maybe not balanced diets atau unbalanced diets maybe will make produce cancer. Overweight, like that, obesity, alcohol, and another. Yeah. The dietary item maybe lack of fruit, vegetable, and more consumption of red meat, like that, or maybe low in fiber consumption. This is the risk factor of cancer. The egg is the first, and maybe geographical, like I saw in the first time, money in the American or European, but low in the Asia. What is a food prospect to anti-cancer? In this time, we can know in the journal, maybe IC50, and the second, maybe it is can 16, yeah, 16. In this time, okay. It is the how to know food is anti-cancer. You can know the number of IC50. IC50, actually for anti-cancer is very low. I think, very low about the IC50. I think only little concentration, the cancer cell line many died. Like that, it is breast cancer and lung cancer and sleep cancer. It is the ppm, 0 ppm or 400 ppm and 800 ppm. Many ppm, the cancer will die, but we must know about the IC50. IC50 is very little, suitable for lung cancer because the IC50 is very low, but it not very low, but there is 335.7. There is many food as anti-cancer. There is in leaf of papaya atau daun papaya, tomato, lonja, apple peel. So if you eat apple, please eat the peel also. Mangosteen peel, kunyit, jamur, tekoka. It is the SC50. So is the suitable atau is good, very good is apple peel really. Apple peel, but maybe extract. because the SC50 is very low. Or maybe there is mangosteen P, maybe the SC50 is 10.5x, and the apple pill is the second.
I'm sorry,
okay,
Dr. Nur Rahman, your time is only 3 minutes left.
Oh, 2 minutes. Okay, it is the botanical anti-cancer. It's money. Okay, it is. I should like to. This is tapak darah. It is the story of the botanical for anti-cancer. Okay, and this is the role of mechanism P53 gen. P53 is the tumor suppressor gen. So as the food for anti-cancer will produce P53 because they suppress the cancer. Okay, I'm not this explain. Maybe I should like to run. Okay. Okay. This is my research, my finding of Solanotropum. The mechanism I have get in the laboratorium. There is solasodin and solamargin, the anti-carcinogenic, yeah. The solamargin, they have anti-carcinogen. Maybe there is anti-inflammatory too, and there is proliferative disease treatment. It's suitable for cancer. Okay, it is the solamargin and solasodin. It's like lapatinib drug cancer. It is my research about the effect of POCA. If there is in the rat give POCA extract, maybe the EL6 will be reduced. So it's suitable for that POCA is for antioxidant to protect the carcinogen. Okay, this is the mechanismnya. It's make the toxin fat soluble, make water soluble, so can eliminate it in the urine. It is the function of antioxidant or nutrient. Okay, this is in the MDA concentration maybe will be reduced to if rat consumption of extract POCA. And the mechanism of there's different chemotherapy and chemopreventive. Chemotherapy is for drug and chemopreventive if we consume diet or non-toxic ingredient. Okay, that is the mechanism of anti-cancer. Can be block anti-carcinogen for normal cell, but if the promotion and progression will stop the cancer for progression. Okay, I will this. It is the cytotoxic drug. That is some of them microtubule make agent. That is vincristine, fibrantine. This is in the tapak darah ya, tapak darah, bunga tapak darah. There is vincristine, fibrantine. The function of microtubule make agent like that ya, inhibit micro. It is mechanism of drug of anti-cancer. Yeah, this many, but vinyl alkaloid is in the plant, in the plant. This is how to inhibit the cell divide. Yeah, this is how to demix the protein. I'm sorry, this is the problem. Okay. Okay, this is nutritionist. Sorry. I'm sorry, I have problem on the ini. So, sorry. I will start again my. Okay. Oh, sorry.
But I'm sorry, Dr. Nur Rahman, your time is over.
Okay. Maybe more than 5 minutes, maybe. No. Okay, this is. Okay, this is sometimes tea. We can consume tea or some type of capsule like that. Yeah. Maybe I will go to my last experiment. I have give person to consume tea and ice cream to control of CD44. It is the result. Maybe the result if also all will have significant pretest and posttest. So the CD44 may be reduced from 109 and maybe make like that. All p-value is significant. CD44 is stem cell cancer. So if the CD44 is low, maybe it's good. It is the many benefit of the POCA. Okay, I don't start. Maybe it is the cancer prevention. Maybe we must have BMI, money exercise, take less than sugar, consumption, fruit vegetable 400 gram, limit red meat, and avoid preservative and alcohol. And maybe, okay, I will take the conclusion. Cancer is disease characterized by cell cycle abnormality caused by DNA mutasi. Plant and diet can reduce risk of cancer occur. Vegetable and fruit is very suitable for cancer prevention. If we have cancer disease or after surgery, we suggest to consume not just vegetable in the form of food, but also from botanical, yeah, maybe like herbal. Consumption tea or ice cream atau coca reduce CD44 in the experiment. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Dr. Nur Rahman, for addressing the interesting topic. Can we wait for question and answer session that will be held after the third speaker presentation? Now, ladies and gentlemen, we proudly present our second presenter, Dr. Dini Mariani, Master of Nursing from Indonesia. Now I will read her CV. Can you share the CV? Okay, Dr. Dini Mariani obtained her doctoral degree in pediatric nursing at Gajah Mada University and Master of Nursing University of Indonesia. Her latest publication is Sundanese Cultured Sensitive Family Nursing Model Improves Behavior in Controlling Blood Sugar in Elderly Patients with Diabetes and Life Experiences of Adolescents with Thalassemia, a qualitative research with phenomenological approach. Her experience as a speaker in training in 2020 optimizing growth and development during the COVID-19 pandemic, and then training for nurse in the management of BBLR, and nurse training in the management of thalassemia. And the latest her research are life experience of adolescents with thalassemia, a qualitative research with phenomenological approach, family experience in caring for children with cerebral palsy, and the effect of giving stimulation to premature babies on motor development. Dr. Dini Mariani is a lecturer in nursing department at Poltekkes Kemenkes Tasikmalaya, and she is currently holding the head of Quality Assurance Center at Poltekkes Kemenkes Tasikmalaya. Today, she will be sharing with us about interprofessional collaboration in managing health and disaster emergency. Well then, please give your full attention to Dr. Dini Mariani. Dr. Dini Mariani, time is yours.
Thank you, Ms. Ida Rosdiana as moderator. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Ladies and gentlemen, allow me to present about interprofessional collaboration in emergency and disaster condition. Please slide. Okay. Next. Okay, ladies and gentlemen, first let's know The definition of interprofessional collaboration, according to the Canadian Interprofessional Head Collaborative, interprofessional collaboration is a partnership between a team of head providers and a client in a participatory, collaborative, and coordinated approach to share decision-making around health and social issues. Okay, ladies and gentlemen, in implementation, interprofessional collaborative practice has been defined as a process which includes communication and decision-making, enabling a synergistic influence of group knowledge and skills. Okay, ladies and gentlemen, there are important characteristics that define a team, including in emergencies and disaster. First of all, members seeing their roles as important to the team. Each team member must be aware of their respective roles in interprofessional collaboration. 2, open communication. There is a process of communication between profession to quickly respond and think critically in emergency and disaster situation. 3, the existence of autonomy. Each profession has autonomy in accordance with the authority of course in one common. And the last, equality of resources. All professions are equal. Nothing is more important and primary. All contribute according to their respective roles. Okay, ladies and gentlemen, it is important to note that poor interprofessional collaboration can have a negative impact on the quality of patient care, including in emergency and disaster. Thus, skill in working as an interprofessional team, which are acquired through interprofessional education, are important for high-quality care. So, it is necessary to prepare students for effective interprofessional education. Okay, ladies and gentlemen, there are barriers to interprofessional collaboration. There are differences in personal values and expectation, personality, culture and ethnicity, language and jargons, schedule and professional routines, regulation and norms of professional education and accountability and rewards. So, these things have an impact on interprofessional and intraprofessional competition. And in the end, there will be fear of a diluted professional identity. Okay, ladies and gentlemen, there are interprofessional collaboration strategies in emergency disaster that must be prepared carefully, include, first of all, open communication. Communication between professions must be open in one common and complement each other in dealing with patients. 2, respectful, clear roles and responsibility. Each profession has atomically understood their respective roles and responsibilities. 3, clear direction atmosphere. There is a clear direction in working, obeying orders, and of course, there is coordination with each other. 4, share responsibility of team success. Share responsibility for team success and building a teamwork climate, of course. 5, acknowledgement and processing of conflict. There is a solution where there is a conflict between professions, not letting the conflict drag on. And the last mechanism to evaluate outcomes and adjust accordingly. There needs to be a periodic evaluation process, both short-term and long-term. Skill to overcome the overlapping tasks that often occur in the practice of interprofessional collaboration. There are performed by various professions. There are many clinical activities that can be done by various health professions. Various tasks, there are several health professions that have the same roles and duties. And clarification, if there is an overlap, important for the team to clarify to do each task. Clarification of roles and tasks that are not clear will lead to duplication or skipping of overlapping roles and tasks. Okay, ladies and gentlemen, there are IPC in outbreak global pandemic is current issues, hot issues. From the beginning of the pandemic, the Interprofessional Research Global, IPR Global, as the global network for interprofessional education and collaborative practice, IPECP, create a COVID-19 task force with a mandate to develop and disseminate relevant, timely, and important information for the global IPECP community and beyond. Since established in March 2020. Okay, ladies and gentlemen, how to build and promote healthcare providers, individual and team resilient? There are some effective strategies that have been suggested as follows: Sanovel, RIF, Trokel at 2020. But of all here, the government or management should listen to complaint, suggestion, and incorporate into IPC practice for the resilience of healthcare providers in emergency and disaster. To protect, healthcare provider must be protected and their health and well-being guaranteed. 3, prepare. Health worker who will be on duty must be prepared carefully, of course. 4, support. Health workers who are members of collaborative interprofessional practice in emergency and disaster need material and non-material support. And the last, care for. Caring not only for the health worker, but for the welfare of their families. Okay, ladies and gentlemen, to thrive and come back stronger from the pandemic, here are 2 major areas that need immediate attention. 1, preventing parallel pandemic of burnout through building individual and team resilience. The imperative of addressing the psychological needs of healthcare provider and interprofessional team has never been clearer. An optimal approach is a global resilience strategy led by influential global organization that can draw on culturally relevant and context-specific expertise to direct policy and practice at both national and organization level, and to share important lessons learned. And 2, back, previous, please. Building resilience among current and future healthcare provider in the era of virtual health education and practice. Okay, next slide. Okay, the following are some of the impacts of the COVID-19 pandemic on health workers according legacy at 2020. Healthcare providers are overwhelmingly burnt out, starting about 84% reported feeling at least mildly burnt out from work, with 18% feeling totally burnt out. 2, healthcare providers are sleep deprived. Alarmingly, about 90% said they have been getting less than the recommended 8 hours of sleep each night, and 1 in 3 admitted to getting 4 hours or less. Healthcare providers are thinking of quitting nearly half, about 48%, have considered either retiring, quitting their job, or changing their careers altogether. Healthcare providers' mental health has significantly deteriorated. About half, 48% of survey respondents reported their mental health has deteriorated. And the last, healthcare providers are more emotional at work of all healthcare professionals. About 49 have cried at work in the past year. And about 67% of all nurse practitioners admitted to doing the same. Okay, ladies and gentlemen, how to build and lead a resilient in healthcare, a global strategy in utilizing collaboration approach. First of all, prior to the pandemic, healthcare education and system transformation were widely accepted as critical to attaining universal health coverage and improving cost-effective care, service delivery, population health, and health providers' work experiences. Interprofessional team-based collaborative care is imperative for high-quality health outcomes. Back. Okay. Stakeholder entities, including global organization, government, healthcare system, educational institution, and from the community. And the last, global strategic direction. Okay. And the last, there are strategic collaborative leadership for system across change, including in emergency and disaster. Next, please. Okay, conduct a need assessment. Conduct a need assessment to gather evidence to understand the system and examine factors within their setting leading to burnout and resulting consequences on healthcare providers, their team member, and patient. To guide health system. Guide health system to foster an environment where the well-being of its healthcare professional is a central key in performance indicator. 3, recommend and implement intervention to enhance healthcare professional well-being and resilience, particularly in the context of practice team. Ensure healthcare providers are well trained on the importance of well-being and resilience as a key component of enhanced team-based care. Develop protocols for healthcare professionals to identify signs of burnout in themselves and team members and corresponding responses. Establish plans for providing additional support for healthcare professionals in need of support. And the last, provide those in need with psychosocial support, counseling, and treatment if necessary. Okay, there are resilient and emergent property of the health system as a whole. In the COVID-19 pandemic has already challenged different components of healthcare system, globally including service delivery, health workforce, health information technologies, access to essential resources, such as medicine and equipment, financing, leadership, and government. Okay, in the last, IPC in emergencies and disaster resilience, in the result of a process that involving communication and decision-making that allow the synergetic effect of quality group knowledge and skill, in the end to reach quality interprofessional collaboration for patient safety. Okay, thank you, ladies and gentlemen. Thank you for your attention. And next, hand over to moderator. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you very much, Dr. Dini Mariani, for your informative presentation. That was very interesting. And please kindly wait for question and answer session that will be held after the third speaker presentation. And I remind you one more time, for all participants, if you have got some question for our speaker, you may use the chat feature in this Zoom webinar, or you can also submit the question by using the link that is provided by the committee at any time during the presentation. The question will be addressed to the speaker in question and answer session. Okay. Okay, ladies and gentlemen, without further ado, let's move to the next speaker. Last but definitely not least, I will introduce you to our speaker from Hacettepe University, Turkey, Ms. Meral Huri, PhD, Associate Professor of Occupational Therapy. Dr. Meral Huri, are you there?
Hello.
Hello, Doc. How are you today? I'm sorry, you still mute. You still mute?
Am I coming? Okay, my voice is coming.
Yes, I can hear your voice clearly.
Hello.
Hello.
It's very nice to be here.
Yes.
Thank you very much for your invitation for the committee and for Dr. Miko and all my colleagues from Indonesia. Thank you very much for your invitation.
Yes, welcome.
When I have your invitation, I thought to present. I thought what to present, and later I was very excited to present our last study about online health sciences education after COVID and what will remain our after COVID beyond COVID because it's it was a very big experience for us and it still continues and all the students, health sciences students, actually students with patient connections are very, very disrupted on this process. So I'm going to inform you a little bit about my article, and now I'm doing my research in Belgium in Catholic Leuven University, which is one of the best universities of Europe. So I will give a little bit summary of the university and some opportunities to collaborate. So thank you for listening to me today.
Yes.
Can you see my present? As you told, I'm from Hacettepe University, Ankara, from Health Sciences faculty. I'm a physical therapist and also I have my PhD on occupational therapy. So it's a kind of, I am one of the two disciplines. I include two disciplines of health sciences. So I'm really very excited to be both professional because I have some experiences on physical therapy and also some experiences with occupational therapy, which are similar but different professions. And Hacettepe University has the physical therapy, occupational therapy, speech and pathologist, and physical education, and also dietitianry and health growth faculty departments in health sciences faculty. And also we have our journal that I wanted to inform you that if you can send some articles to our journal, we can publish them. And you see there are some view of our university. But now I am in KU Leuven University in Belgium. It's really an old university. It was established about in the 15th century, like 1425. It's really an old university, and this is the main building of the university. And the Department of Health Sciences is really quite interesting and well-developed university. This university is one of the biggest university of Europe, and it's the best fourth university after Oxford and Cambridge universities. As you see in the picture, there is a big library of this university. I just put this university because the library is really very important, because it was rebuilt in the First and the Second World Wars. After the Second and World Wars, it was destroyed, and by help of some European countries and US, and also I think help of Russia, they rebuilt it, and you see the inside of it. This is a real photo that students can work such a nice building in a library. And at sciences faculty and the master and PhD programs are still ongoing in this university, and they have a very nice collaboration and interdisciplinary master and PhD programs. So I just wanted to inform you about KU Leuven University also. Yes. Now I'm in Leuven. It's a little city in close to Brussels, and I'm staying in a house where Erasmus was stayed years before, about in 1502. From the Britannica, it says that he was reading and he was doing his research on Oregon and St. Paul's in Greek in these houses. I'm staying in one of the houses that Erasmus lives now. Here you see where I'm staying here. As you see, there is about 300 houses, and the houses belongs to sisters, and they give lots of. The sisters were living here for over 75 years, and then KU Leuven University hired these houses, and now they're giving these houses to the exchange program, doctoral program students, or the academic staff. It's called Growth Beguine of Leuven. So I'm really very precious to stay here. Yes, during this time, during my research in KU Leuven, I'm a little bit interested in the history of rehabilitation. Here you see Dr. Pinal. He's one of the oldest pioneers of psychiatry. And at that time, people were treated, or psychiatric patients were treated in not hospitals. They were staying in places like hospitals, but they were, as you see, they were putting the patients chains, and they were putting ropes to the patients, and they say that they have lots of problems, like not mental, but it was something that religious, or something that bad ideas, bad thoughts were coming to patients. But Dr. Pinal changed the idea, and patients, as you see from the picture or art, Dr. Pinal is breaking the chains of a patient. So after Dr. Pinal, the approach to psychiatric patients has changed, and people try to help this kind of patients. And also you're seeing another view of a physical therapy painting at Bath War Hospital after the First War. The soldiers were treating there, So when we look for the art and the history, we can see that there are lots of things were done in the history about health rehabilitation, health sciences. And I also put some old examples or old pictures of occupational therapy and physical therapy education, how they educate. As you see in the first of 19th the first occupational therapy, that patients a new job. They have to teach them to earn their money. Because here you see that they're learning new jobs like doing handcrafts and arts, and PTs and OTs work together. Sorry, and they were doing some art crafts, handcrafts, and they were selling them. By this way, they can earn their money, and it's a kind of vocational rehabilitation during that time. And I wanted to put the medical from the Rembrandt's art. It's a really very nice and important picture of Rembrandt that people are working on anatomy, and also it was the history of dentistry. You can see the people are interested in dentistry from the ancient Egypt, and there are lots of histories, there are lots of sculptures on this also. So from the occupations, or from the view of professions, with COVID-19, our lifestyle is changed. As you know, from occupational view, the key to unlocking the occupations came very important, because with coronavirus, everybody was restricted, education system was restricted, so we had an urgent changing style in the healthcare profession education. So health sciences education is changed with COVID, and the sudden move to online technologies has been experienced by many of the professions like PT, OT, nursery, or medical doctors, or dentistry. They're all came online, and the online education gained importance, because you have to give the education online, but we were not very used to it, because our professions are health-related professions, and it includes patients, it includes one-to-one therapies. So it's important to do this in education face-to-face, but we couldn't have that opportunity. So COVID-19 response changed the university educations, and moved all the teaching and assessment activities online relatively in a very short time. It was not at the first time, I think, in Turkey, for example, we could not do a very nice online education, but it was like starting. At the beginning, we was very shocked, and we didn't know how to cope with that, as maybe you had the same thing. But after, in a short while, we prepared some educations for educators of the health sciences professionals, and with that educations, we learned how to collaborate, or have to give our lectures online to health professionals. And as a result, all classes, simulations, practices, and assessments were adapted to online environment and launched. So it's online education became very important for allied health, health sciences, dentistry, medicine, nursing, pharmacy, and also biomedical sciences. Yes, what we see in the professional education and collaboration, the previous speaker told about that it was very nice that we mentioned, we're going to mention, I think, the same thing. And in the professional education, we have the early learners, which learners became very enthusiastic to learning, but they do not know too much about the profession. And after a little bit, like in the third class, 2 and 3rd classes, they became advanced learners. And at the end, at the 4th or the 5th grade, the professional become practitioner. They can see patients, they can have patients. So it's important. There are some important points which we must give them in online education also to make them to give effective, efficient, appropriate, and collaborative practice. We have to first maintain their high attitudes like value and ethics. If we cannot give the value or the ethics idea to the students in the first early learning period, it's hard to work on effective, efficient, appropriate, and collaborative practice in health sciences. So ethics and values, what are the values? Values are the ideas of the professions. What is important for you? What's important for the profession? It's not money. It's not just help, giving help or doing your job. It's the value is what you gain from your history of profession, what you gain, what you have, how you can use yourself to give therapy or to give health for the patient. It's very, really very important. And for example, in our recent syllabuses, we put psychology classes, we put lots of philosophy classes to add value to our professions. Because if it goes to just medical, or if it goes to just the patient or patient problems, or if the profession is out of from the process of health and health giving, then the value of the profession is that it's not understood, and ethics that we all very invested in this, and giving and using ethics.
I'm sorry, Doc. Your time.
It's the first area of the education, and in the second area, we have to give the core knowledge of roles and responsibilities. What is the roles and responsibilities of the profession, and what is communication, what is team. So this is the second area. And the third is the collaboration skills, which is communications and teams working. So you can be a team member, but you cannot work in a team in a good way. So it's important to understand the team. It's important to understand communication. It's important to be a part of team working. So we must give all three basic areas to our health science professionals, but now we're trying to give this without seeing them, or without connecting them, without touching them. It's just online education. So we have to give these three main cores in online education to make our students practice effective, efficient, appropriate, and collaborative. I think it's really hard, but it's not, it's easy. As you see, to give this skills, we have to, if we can think like a tree, as you see, the roots are the pre-curricular experiences, and then we can, the tree is growing and foundation health professional experiences, we can increase them, and later the professional specific experiences, and then we will give the context in specific experiences. And by this way, the interprofessional, we can expose the student interprofessional problem solving. Then after exposing the problem, they can experience interprofessional problem solving, and later they can solve the problem. And later, when they solve their problem, they can engage in shared problem solving process. So it's important to give all these sections later and later and later. It's like a pyramid. So we can give this with online education. Yes,
I'm sorry, Doc.
Online
I'm sorry.
education.
Your time is all.
The self-regulation skills, technological literacy and competency skills, student isolation, technical sufficient, and
Prof. Merahuri, I'm sorry.
And their learning.
Prof.
So,
I'm sorry. Unfortunately, your time is over.
Okay, and then
the last slide, maybe.
Yeah. So the adaptation skills of the students are important. So we can adapt, we can help them to adapt, and in the future, who is going to live? The ones who has the money or the ones who are very clever? No, the future professions are the ones who has the adaptation skills. So thank you very much for participating.
Thank you very much, Dr. Merahuri, for your valuable time and for the interesting talk. Ladies and gentlemen, before we move to question and answer session, I will introduce about our last speaker, Dr. Merahuri. Dr. Merahuri earned her doctoral degree of ergotherapy at HCTP University. Her research focused on occupational science and the impact of occupational therapy. She was awarded for her 2 studies in rehabilitation of patients with prostate cancer and interdisciplinary team approach in community healthcare. She is also certified neurodevelopmental treatment and sensory integration and praxis. She is currently working in Q11 University, Belgium at Movement and Rehabilitation Sciences Faculty and at HCTP University, Faculty of Health Sciences, Department of Occupational Therapy. All right, ladies and gentlemen, now we come to question and answer session. It will be held for about 30 minutes, and some of you have already submitted your question, and our committee has already compiled them, that I'll read them out loud. The first turn will be addressed for Dr. Nurrahman. Dr. Nurrahman, are you still there?
Okay, I'm ready.
Okay, and the first question is come from Wulansari, and her question is, some tradition in Indonesia have point of view about the source of leaf for prevent the cancer. With drink the source of leaf which soak in boiled water. Is it true? And any side effect if we consume this? Okay, Dr. Nurrahman, you may answer the question.
Okay, thank you about the question from Wulansari. I think it is true that soak in boiled water about source of leaf, it have antioxidant. I ever research about this one, and the antioxidant is still in that. So if people consume about this water from soak in boiled water about the source of life is a good, but it for people who cancer disease. But if you have healthy people, not consume this one. If healthy people consume money juice like tomato, like mango, like apple, and etc. It's just for the people disease in cancer like that.
Is it all?
Yeah. Any vegetable? I think don't afraid if we cook about vegetable. Okay. By cooking, all vitamin C is lost, but many antioxidants still in there, like vitamin A or vitamin E, A or E, A. But vitamin C will be lost. But there is still antioxidant in there, like vitamin A or vitamin E, like that. So don't afraid by this process.
Okay.
Okay.
Okay, thank you for your insightful answer, Dr. Nur Rahman. Now, the question for Dr. Dini Mariani, and the question come from Mulyani. Okay, Dr. Dini, you may answer the question.
Okay, please.
Do I need to read again?
Okay, please.
Okay. The question comes from Mulyani, and the question is, what resilience is in healthcare in disaster condition?
Okay, thanks for nice question from Yuliani.
Mulyani.
Mulyani. Okay, thank you, Miss Mulyani. Okay, I will answer what resilient in healthcare in disaster condition. Resilient in healthcare in disaster condition can be seen from several elements, I think, including patient, interprofessional teams, stakeholder, and organization or institution, I think. In patients such as improve access, comprehensive and collaborative treatment approach, holistic well-being, and increase satisfaction, of course. And another elements from interprofessional based care, such as interprofessional team-based care, quality improvement. Another element from stakeholder, such as policy makers, insurance, research funder. And the last element from organization, of course, such as resources allocation, infrastructure, quality improvement, I think. That's all.
Okay, thank you, Ms. Dini. And now the second question comes from Nurdiana. He asked about what abilities should a health organization or system have to be resilient?
Nice question too, thank you. Okay, I will answer the abilities, yeah. What abilities should a health organization or system have to be resilient?
Yes,
correct?
Yes.
Okay.
Correct.
Yes, but there are effectively respond to new stimuli, such as the COVID-19 pandemic through adaptation. As we know, the government has responded quickly in this pandemic condition. Massive information dissemination, comprehensive and such as in giving immunization and others, I think. and monitor and measure both internal and external factors affecting its performance, and then another abilities such as learn from a prior experience or the previous experience and change in performance accordingly. And the last, of course, must anticipate and be ready to effectively address future stimuli that could affect its performance. I think that's all, Ms. Ida.
Okay, I think enough the question for you, because we have another speaker, to Meralhuri. And I have 3 questions for Dr. Meralhuri. And the first question is come from Ms. Meti. From your experience, Dr. Meralhuri, about the implementation of skill learning in occupational therapy along pandemic, how the learning process did in your institution?
Actually, in my institution, in my school, first we organized, it was, sorry for a delay, I was a little bit slow for the PowerPoint, so I couldn't mention that area. We first organized an education for educators. So we organized the education for educators, how they must put the aim of the online education, and then how they can assess the skill. For the skill education, we put outcome assessments for each lecture, or for the lectures totally, for each lecture, and at the end we put some new, or we add some new outlines for the professional 4-year education aims. And then we took some certain research on the aims, and the results are equal to each other. And for this time, we all can do the online education, but the problems for the field works, we have to give our students field work areas with lots of areas like pediatrics, geriatrics, or cancers with cancer patients, or sensory integration. So the fieldwork was a problem. At the first areas, we put some examples of some patients. We took from our previous patients, we had some videos. We first started to do fieldworks with that online video education. But later in the second term, we add the patient online rehabilitation, that telehealth rehabilitation. During this process, one coordinator was online and the students was online. And then the coordinator was doing the tele-rehabilitation to a real patient with the help of the caregiver. And after 10 sessions, the students have the opportunity to do that telehealth rehabilitation. And later, now what we're doing now, we're doing a hybrid program. We're giving the student online video education first, and then later the telehealth, and later we combine now the education in fieldwork in our school. We have 12 fieldwork areas in our school. So they're seeing patients, but with precautions of COVID-19, like the vaccination and the masks, and trying to look at their health passes. We have a system that reads the health pass before the treatment session or before coming to fieldwork area. But when we compare the reaching our outline or our aims to the fieldwork, it's growing. It was not very nice in the first year. Now it's about 70% is they say, yes, this field work is nice. But in our research, we found that online occupational therapy is not very suitable for occupational therapy, because you have to see the patient, you have to be connected with the patient for occupational therapy. Primarily for the pediatrics, it's very important to see the patient at least once a week. Maybe we can combine it with video education or online telerehabilitation, but just one telerehabilitation or online education is not very suitable for the fieldworks of education.
Okay.
Thank you.
Thank you. That was very interesting, Dr. Meralhuri. And now, I think in the last question, because we have no time anymore. And the last question is come from Anindita. She asked about, can you more explain about the evaluation process in IPE?
Yeah, I think this too, I'm reading the third question also. I'm going to answer them in both. Actually, doing IPE is very important for students and also for our patients. For students, we add some online education aims to the IPE. Otherwise, it's if it stays in the face-to-face education IPEs, then our competencies will not be enough. So we put online education. During this online educations, we put the some cognitive skills, some computer-based skills, some transferable skills, and also we put communication and relationship and teamwork skills, but they're all online. So we all add some new aims to each lesson's IPE. And for the community services, it's really very important that the field works are transferred to the community. We had done this before. We were a little bit experienced in community-based rehabilitation. But the important thing is to show how you do the research on the community and the research on IPE. So we are really working on assessing the how it changed online education, what changed the online education. So we are really very working on this research.
Okay, thank you very much, Dr. Meralhuri. Unfortunately, we ran out of time, so we need to end this question and answer session. Thank you for all speakers for answering the question and for the great presentation. It was a pleasure to have you all with us today. Okay, ladies and gentlemen, we have almost reached to the end of this session. Now, on behalf of this International Conference Committee, I'd like to say thank you to Ms. Meralhuri, PhD, Associate Professor, Dr. Dini Mariani, and Dr. Nur Rahman for sharing your expertise and experience with us. As a token of our appreciation to our guest speaker for their time and their valuable contribution, may I request to the first Vice Director of Poltekkes Kemenkes Tasikmalaya, Dr. Haji Iwan Somantri, to kindly present a certificate to the speaker.
Okay, Dr. Nur Rahman, Dr. Dini and Mrs. Merahuri, PhD, Associate Professor. Thank you very much for your participation in this conference. And here are the certificates as all of your speakers. The first for Dr. Nur Rahman, I give your certificates. And then
thank you,
the second one.
Pak Iwan.
Okay, thank you, Dr. Nur Rahman. And then the other ones, the certificates for Merahuri, PhD Associate Professor. Okay, Mr. Merahuri, I give you certificates. Once again, thank you, Merahuri, PhD. And the last one, the certificate for Mrs. Dini, Miss Dr. Dini, I'll give here directly, okay, Miss Dini. Once again, thank you, Mrs. Dini, Dr. Miss Dini. Okay, thank you very much.
Thank you very much, Dr. Haji Wan Somantri. All right, before we end this session, I would like to summarize the topic from our speakers today. Plant and diet can reduce risk of cancer occurrence. Vegetable and fruit is very suitable for cancer prevention. Consumption vegetable for 100 grams per day will protect normal cell from carcinogen. Interprofessional collaboration in emergencies and disaster resilience is the result of a process that involves communication and decision-making that allows the synergistic effect of quality group knowledge and skills. And after the COVID-19 pandemic, online education has become very important, and we are required to adapt to this change. Best practice in health science education need curriculum model, competency enhancement, competency assessment, competency improvement, and continuing education. Ladies and gentlemen, the second session of the International Conference on Health, Education and Technology has come to an end. Thank you very much for your active participation, and I hope you enjoy your conference. And now I'm going to hand over to our Master of Ceremony, Ms. Kanita Wulandra. The time is yours. Assalamualaikum warahmatullahi wabarakatuh. Thank you, Mrs. Ida Rosdiana. Wow, such a nice presentation from all of the speakers. And dear ladies and gentlemen, the second session of the plenary speech has come to an end. Then we would like to invite you to parallel session, namely oral presentation. But before going on to that parallel session, we will have a break and we will resume at 1 o'clock. Thank you. Have a break. Assalamualaikum warahmatullahi wabarakatuh.
Welcome to Poltekkes Kemenkes Tasikmalaya. Poltekkes Kemenkes Tasikmalaya is one of the best universities in the East, Priangan, and Cirebon.
Education system in Poltekkes Kemenkes Tasikmalaya is implemented based on the decree of the Ministry of Health, Republic of Indonesia. To provide professional service, Poltekkes Kemenkes Tasikmalaya applies the quality assurance system which has been certified by SAI Global ISO 9001 and 2015.
Poltekkes Kemenkes Tasikmalaya provides 6 majors and 14 study programs which have been accredited by BANPT and LAMPTKes.
Nursing Department. Midwifery Department. Dental Nursing Department. Nutrition Department. Medical Record and Health Information Department. Pharmacist Department. Poltekkes Kemenkes Tasikmalaya has facility to support academic, and non-academic activities. Poltekkes Kemenkes Tasikmalaya Transportation. Library. Computer Laboratory. There are also student activity units, such as sport and traditional dancing. Poltekkes Kemenkes Tasikmalaya is one of the best university in East Priangan and Cirebon.
Visit us in Poltekkes Kemenkes Tasikmalaya.
kita divaksin.
Saya sudah divaksin.
Terima kasih Polkes Tama Kampus Cirebon, mantap.
Saya siap divaksin biar bisa tatap muka di sekolah lagi.
Kami siswa SMP 9 Tasikmalaya siap untuk divaksin.
Kami ingin sehat dan pandemi segera berakhir.
Biar kami bisa sekolah tatap muka seperti dulu.
Ayo divaksin.
Untuk seluruh pelajar di Indonesia,
mari ikut vaksinasi
agar pandemi cepat selesai
dan bisa sekolah tatap muka seperti biasa.
Mari divaksin.
Terima vaksin, masyarakat sehat, Indonesia sehat. Terima kasih Poltekkes Tasikmalaya.
Dari Tasikmalaya untuk Indonesia.
Apa? Divaksin, gaskeun.
Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera untuk kita semua. Perkenalkan, saya Hadiat Niko dari Politeknik Kesehatan Tasikmalaya. Pada kesempatan ini, saya akan menyampaikan penjelasan mengenai hasil inovasi kami berupa ventilator sederhana. Ventilator merupakan alat bantu pernafasan atau biasa disebut resusitator. Dalam masa pandemi COVID-19 saat ini, kebutuhan alat bantu pernafasan sangatlah diperlukan dalam penanganan gawat darurat penderita COVID-19. Untuk memenuhi kebutuhan pasien COVID-19 yang mengalami masalah pernafasan, alat yang ada di Kota Tasikmalaya masih sangat kurang. Melihat permasalahan yang ada, kami, tim dari Politeknik Kesehatan Tasikmalaya, membuat sebuah inovasi berupa ventilator sederhana untuk menanggulangi masalah gangguan pernafasan ringan sampai sedang pada penderita COVID-19. Ventilator sederhana hasil inovasi kami sudah dilakukan uji kelayakan di BPFK Jakarta pada tanggal 12 Mei tahun 2020. Hasil uji coba alat tersebut ada beberapa masukan terkait dengan penyempurnaan dalam hal kerja alat. Prototipe alat ini dijadwalkan untuk uji kelayakan tahap kedua di BPFK setelah perbaikan berdasarkan masukan dari pengujian tahap pertama. Dalam video ini, kami baru sampai pada tahap gerak mekanik. Untuk program elektrik dan program komputerisasi akan dijadwalkan kemudian di pengembangan inovasi ini. Besar harapan kami, mudah-mudahan hasil inovasi ini bisa mendapatkan ventilator yang berfungsi maksimal dengan harga yang murah untuk menanggulangi permasalahan penanganan gawat darurat gangguan pernapasan pada pasien darurat COVID-19. Demikian penjelasan inovasi dari kami, Politeknik Kesehatan Tasikmalaya. Semoga bermanfaat. Wassalamualaikum warahmatullahi wabarakatuh.
Recording stopped.
nama saya Emma Camelia. Saya berasal dari Poltekkes Kemenkes Tasikmalaya dari jurusan Keperawatan Gigi. Pada kali ini, saya akan memperkenalkan topik inovasi baru yang berasal dari Poltekkes Kemenkes Tasikmalaya yang dinamakan extraoral suction. Cara penggunaan alat ini yaitu pertama-tama kita hidupkan ada tombol, ya di sini tombol on off-nya, dan ini adalah untuk yang kedua untuk mengatur kecepatan. Ya, jadi kecepatan untuk penyedotan ini kita bisa atur di dalam tombol ini. Nah, kita akan coba untuk kita hidupkan ya. Ini adalah tombol untuk on, atau kita hidupkan di awal untuk start ini. Jadi produk aerosol yang berasal atau kotoran yang berasal dari mulut pasien, dari gigi, pengeboran gigi, dari pembersihan kanal gigi atau produk sejenisnya akan masuk ke sini. Masuk ke sini dan dia akan terus berjalan masuk ke dalam kotak filter ini. Nah, di mana di dalamnya itu berisi cairan klorin. Ini adalah cairan yang sangat penting karena cairan klorin ini adalah untuk membunuh virus, bakteri, mikroorganisme atau dan sejenisnya. Ini akan dibunuh oleh klorin. Nah, apabila sudah tertampungnya banyak, maka dapat dikeluarkan melalui filter kecil yang ada di belakangnya yang sewaktu-waktu bisa atau dapat kita buka. Alasan penggunaan alat ini karena alat yang ada masih berupa alat yang diimpor dari luar negeri. Jadi di sini kami coba untuk membuat dan merakit sendiri alat-alat yang ada di seputaran daerah kami, yaitu di kota Tasikmalaya, dan kami rakit menjadi bentuk seperti ini dan sangat-sangat bermanfaat sekali untuk di era pandemi, khususnya pada era new normal. Alat ini sangat murah dan sangat-sangat bermanfaat digunakan untuk tenaga kesehatan gigi. Demikianlah penjelasan kami tentang produk baru inovasi dari kami dari Poltekkes Kemenkes Tasikmalaya jurusan Keperawatan Gigi yang bernama extraoral suction. Di mana extraoral suction ini sangat-sangat amat berguna dan bermanfaat untuk masa pandemi Covid ini, khususnya di era new normal. Terima kasih atas perhatiannya dan wassalamualaikum warahmatullahi wabarakatuh.
Welcome to Poltekkes Kemenkes Tasikmalaya. Poltekkes Kemenkes Tasikmalaya is one of the best universities in the East, Priangan, and Cirebon.
education system in Poltekkes Kemenkes Tasikmalaya is implemented based on the decree of the Ministry of Health, Republic of Indonesia. To provide professional service, Poltekkes Kemenkes Tasikmalaya applies the quality assurance system which has been certified by SAI Global ISO 9001 and 2015.
Poltekkes Kemenkes Tasikmalaya provides 6 majors and 14 study programs which have been accredited by BANPT and LAMPTKS.
Nursing Department. Midwifery Department. Dental Nursing Department. Nutrition Department. Medical Record and Health Information Department. Pharmacist Department. Poltekkes Kemenkes Tasikmalaya has facility to support academic and non-academic activities. Poltekkes Kemenkes Tasikmalaya Transportation. Library. last year. There are also student activity units, such as sport and traditional dancing. Poltekkes Kemenkes Tasikmalaya is one of the best university in East Priangan and Cirebon.
Let's join us in Poltekkes Kemenkes Tasikmalaya.
Mari kita divaksin.
Saya sudah divaksin.
Terima kasih Polkes Tama Kampus Cirebon, mantap.
Saya siap divaksin biar bisa tatap muka di sekolah lagi. Kami siswa SMP 9 Tasikmalaya siap untuk divaksin.
Kami ingin sehat dan pandemi segera berakhir.
Biar kami bisa sekolah tatap muka seperti dulu.
Ayo divaksin.
Untuk seluruh pelajar di Indonesia,
Mari ikut vaksinasi
agar pandemi cepat selesai
dan bisa sekolah tatap muka seperti biasa.
Mari divaksin.
Terima vaksin, masyarakat sehat, Indonesia sehat. Terima kasih Poltekkes Tasikmalaya.
Dari Tasikmalaya untuk Indonesia.
Apa? Divaksin? Gaskeun.
Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera untuk kita semua. Perkenalkan, saya Hadiat Miko dari Politeknik Kesehatan Tasikmalaya. Pada kesempatan ini, saya akan menyampaikan penjelasan mengenai hasil inovasi kami berupa ventilator sederhana. Ventilator merupakan alat bantu pernafasan atau biasa disebut resusitator. Dalam masa pandemi COVID-19 saat ini, kebutuhan alat bantu pernafasan sangatlah diperlukan dalam penanganan gawat darurat penderita COVID-19. Untuk memenuhi kebutuhan pasien COVID-19 yang mengalami masalah pernafasan, alat yang ada di kota Tasikmalaya masih sangat kurang. Melihat permasalahan yang ada, kami, tim dari Politeknik Kesehatan Tasikmalaya, membuat sebuah inovasi berupa ventilator sederhana untuk menanggulangi masalah gangguan pernafasan ringan sampai sedang pada penderita COVID-19. Ventilator sederhana hasil inovasi kami sudah dilakukan uji kelayakan di BPFK Jakarta pada tanggal 12 Mei tahun 2020. Hasil uji coba alat tersebut ada beberapa masukan terkait dengan penyempurnaan dalam hal kerja alat. Prototipe alat ini dijadwalkan untuk uji kelayakan tahap kedua di BPFK setelah perbaikan berdasarkan masukan dari pengujian tahap pertama. Dalam video ini, kami baru sampai pada tahap gerak mekanik. Untuk program elektrik dan program komputerisasi akan dijadwalkan kemudian di pengembangan inovasi ini. Besar harapan kami, mudah-mudahan hasil inovasi ini bisa mendapatkan ventilator yang berfungsi maksimal dengan harga yang murah untuk menanggulangi permasalahan penanganan gawat darurat gangguan pernapasan pada pasien darurat COVID-19. Demikian penjelasan inovasi dari kami, Politeknik Kesehatan Tasikmalaya. Semoga bermanfaat. Wassalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh. Nama saya Emma Kamelia. Saya berasal dari Poltekkes Kemenkes Tasikmalaya dari jurusan Keperawatan Gigi. Pada kali ini saya akan memperkenalkan topik inovasi baru yang berasal dari Poltekkes Kemenkes Tasikmalaya yang dinamakan Extraoral Suction. Cara penggunaan alat ini yaitu pertama-tama kita hidupkan ada tombol. Ya, di sini tombol on off-nya, dan ini adalah untuk yang kedua untuk mengatur kecepatan. Ya, jadi kecepatan untuk penyedotan ini kita bisa atur di dalam tombol ini. Nah, kita akan coba untuk kita hidupkan ya. Ini adalah tombol untuk on atau kita hidupkan di awal untuk start ini. Jadi produk aerosol yang berasal atau kotoran yang berasal dari mulut pasien, dari gigi, pengeboran gigi, dari pembersihan kanan gigi atau produk sejenisnya akan masuk ke sini, dan dia akan terus berjalan masuk ke dalam kotak dapat dikeluarkan melalui filter kecil yang ada di belakangnya yang sewaktu-waktu bisa atau dapat kita buka. Alasan penggunaan alat ini karena alat yang ada masih berupa alat yang diimpor dari luar negeri. Jadi di sini kami coba untuk membuat dan merakit sendiri alat-alat yang ada di seputaran daerah kami, yaitu di kota Tasikmalaya, dan kami rakit menjadi bentuk seperti ini dan sangat-sangat bermanfaat sekali untuk di era pandemi, khususnya pada era new normal. Alat ini sangat murah dan sangat-sangat bermanfaat digunakan untuk tenaga kesehatan gigi. Demikianlah penjelasan kami tentang produk baru inovasi dari kami, dari Poltekkes Kemenkes Tasikmalaya jurusan keperawatan gigi yang bernama Extra Oral Suction, di mana Extra Oral Suction ini sangat-sangat amat berguna dan bermanfaat untuk masa pandemi COVID ini, khususnya di era new normal. Terima kasih atas perhatiannya dan Assalamualaikum warahmatullahi wabarakatuh.
Welcome to Poltekkes Kemenkes Tasikmalaya. Poltekkes Kemenkes Tasikmalaya is one of the best universities in the East, Priangan, and Cirebon.
Education system in Poltekkes Kemenkes Tasikmalaya is implemented based on the decree of the Ministry of Health, Republic of Indonesia. To provide professional service, Poltekkes Kemenkes Tasikmalaya applies the quality assurance system which has been certified by SAI Global ISO 9001 and 2015.
Poltekkes Kemenkes Tasikmalaya provides 6 majors and 14 study programs which have been accredited by BANPT and LAMPTKes.
Nursing Department. Midwifery Department. Dental Nursing Department. Nutrition Department. Medical Record and Health Information Department. Pharmacist Department. Poltekkes Kemenkes Tasikmalaya has facility to support academic and non-academic activities. Poltekkes Kemenkes Tasikmalaya Transportation. Library. Computer Laboratory. There are also student activity units, such as sport and traditional dancing. Poltekkes Kemenkes Tasikmalaya is one of the best university in East Priangan and Cirebon.
Visit us in Poltekkes Kemenkes Tasikmalaya.
Ladies and gentlemen, welcome back to this conference. Now we are going to have parallel session in 5 minutes. We ready? Here we have 4 breakout rooms with the specific field. They are room 1 about nursing and midwifery, hosted by Dr. Meti Widyalestari, Master of Midwifery. Room 2 about nursing and midwifery, hosted by Mrs. Bayu Irianti, Master of Midwifery. Room 3 about health science, medical nutrition, and pharmacy, hosted by Mr. Asep Abdul Rahman, Master of Science. And last but not least, room 4 about medical record and health information, health technology, education technology, engineering technology, hosted by Mr. Pijar Beina Fatamorgana, Master of Science. To all presenters, please, you can join the room on breakout room based on parallel session schedule and guideline. And to all the audience, you can also join the breakout room based on your preference. Thank you. Well, ladies and gentlemen, the closing ceremony is going to start. Distinguished guests, participants, ladies and gentlemen, we have had productive and inspiring time together. And this event is about come to the very end. I hope you have found the presentation on this conference informative and also helpful. To end the conference, I would like now to call upon Dr. Iwan Somantri, Master of Nursing, as the first Vice Director of Poltekkes Kemenkes Tasikmalaya, to present us with the closing speech and ceremony, and also announcement about the best presenter at oral presentation. Dr. Iwan, time is yours.
Okay, thank you. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. I believe that during this day, all of us have obtained a fruitful discussion in this first International Conference, Health Education and Technology 2021, whose main theme is Interprofessional Collaboration on Resilience in Health and Disaster Emergency. We have learned a lot from the keynote session delivered by the amazing keynote speaker and invited speakers who have shared their interesting work. Once again, on behalf of the committee, thank you for delivering such important materials so that all of us can depend on our knowledge about health and disaster emergency. Furthermore, I would like to thank all presenters and participants who have joined this conference from all over the world. I am certain that every presenter has presented the application of health, education, and technology research. I sincerely hope that through your presentation and discussion afterwards, all of us can contribute to solving the health problems in our own country, even though the contribution may be small, but it is still valuable. Ladies and gentlemen, although this is the end of the conference days, but the conference process is not over yet. There are still some steps that should be done. First, please submit your full paper manuscript to International Conference Health Education and Technology System by the maximum date on December 25th, 2021. Second, we will review your paper and send you to the result. Third, please revise your paper according to reviewers. Regarding this matter, please make a revision immediately after getting the result of the review. We will submit it to the publisher index corpus or Web of Science. The waiting time will also be various. Therefore, we kindly ask for your patience. The next things I would like to say, we are happy to announce the Best Presenter Awards. So, the Best Presented Award will be given to, from room 1, Idawati Manurung from Poltekkes Tanjung Karang. From room 2, Yati Budiarti from Poltekkes Tasikmalaya. From room 3, Sri Rezeki Nur Endah from University of Perjuangan. And from room 4, Erika Puspita from Poltekkes Banjarmasin. Alhamdulillah, all of your presenters, the best presenters. Finally, I would like to thank all the committee members for organizing this conference and ensuring that it proceeds smoothly. I would also like to apologize for any inconvenience that you might experience during this conference. Ladies and gentlemen, there is a saying in bahasa Indonesia, ada perjumpaan maka ada perpisahan, which means when there is a meeting, then...
And this conference, I would leave you with a quote by Stewart Brand, an author and also innovative thinker, who once said, "We can see the past, but not influence it. We can influence the future, but we cannot see it." Let us all be guided by all the things we have learned and heard throughout the conference and be able to see and influence our future. Thank you, thank you, thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.